kindly gather in the hall. We'll start the meeting in another 2 minutes.
Good morning, ladies and gentlemen. I extend my warm welcome to all of you and for the unique one-day program, Resilient Mind, Thriving Business. Every choice we make in business flows from a way we think, feel, and respond. Today's program empowers us with psychological insights that nurture resilience, inspire leadership, and fuel sustainable growth. We are delighted to have such an inspiring gathering of entrepreneurs, business leaders, professionals, and change makers. To begin the inaugural session, I respectfully invite our distinguished dignitaries to kindly take the seats on the dais, please. Dr. P. Keshav, President, Indian Medical Association, Telangana. Sir, please come over, sir. Dr. Dilip P. Bhanushali, former National President, Indian Medical Association. Thank you, sir. Shri R. Ravi Kumar, President, FTCCI. Please come over, sir. Shri K.K. Maheshwari, Senior Vice President, FTCCI. Please come over, sir. Shri Srinivas Garimala, Vice President, FTCCI. Please come, sir. Shri Shekhar Agarwal, Chairman, Healthcare Committee, FTCCI. Please come down, sir. As a mark of respect and our commitment to growth and sustainability, I request President Shri Ravi Kumar sir to present a plan to Dr. P. Keshav. I request Shri K.K. Maheshwari, Senior Vice President, FTCCI, to present a plan to Dr. Dilip P. Bhanushali. Thank you, sir, for your gracious presence. I would like to recognize the presence of esteemed doctors, Dr. Kishan Rao, Dr. Baijesh, Senior Cardiac Surgeon Dr. Anand, who came over from Bangalore. And we are honored to have your presence here today, sir. Thank you very much. Before we commence the formal addresses, we will begin with the traditional lighting of the lamp, symbolizing knowledge, wisdom, and enlightenment. I request all the dignitaries on the dais to kindly step forward for the lighting of the lamp ceremony.
Shubham kurutvam kalyanam आरोग्यं धनसम्पदः शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शत्रुबुद्धिविनाशाय दीपज्योतिर्नमोऽस्तुते दीपज्योतिर्नमोऽस्तुते दीपज्योतिर्परब्रह्म दीपज्योतिर्जनार्दनः दीपज्योतिर्परब्रह्म दीपज्योतिर्जनार्दनः दीपो हरतु मे पापं सन्ध्यादीपनमोऽस्तुते।
Thank you to all our esteemed dignitaries. With the lamp shining bright, my today's deliberations illuminate our minds and strengthen our leadership journey. To formally welcome the gathering, I now invite Shri R. Ravi Kumar sir, President FTCCI, to deliver and welcome the welcome address. Over to you, sir.
Once again, very good morning to one and all. And we are grateful to Mr. Dilip and Dr. Dilip and also Dr. Kishan and the speakers who have assembled here for the event today. And as all of you are aware that FTCCI keeps doing almost about 100 and odd programs, about 150, 140 programs. And this year, under the leadership of Mr. Shekhar Agarwal, we felt that we should start something a little different rather than focusing exclusively on the industry. So we were also looking at how people can withstand their stresses in life and how they can handle their mind and at the same time thrive in business. So according to me, when you talk of thriving in business, the first thing we think is, if my business is doing 10 crores today, how will it become 40 crores? How will it become 50 crores? So there are two types of businesses. One business is growing your industry or your profession, and the second business is growing to understand your mind and controlling the mind. So I think both will be handled by the eminent speakers today. And to manage people, you have to manage your mind. This is very important. Mind is something which doesn't listen to us. Can anyone disagree to this? Mind keeps oscillating like a pendulum without our knowledge. How much ever I tell the mind to stop, it doesn't stop. It keeps oscillating like a pendulum. And when it goes to the past, usually it's a sense of regret that it shouldn't have been like this, I shouldn't have done this, or I should have done a little better. And things like that come generally. Yes or no? Are you all here? Yeah? And when mind goes to the future, it's a sense of anxiety. When will I get recognition? When will I get promotion? When will people understand me? When will that happen? When will this happen? Either of the time, the mind is oscillating like a pendulum, and either I accumulate a sense of regret or a sense of anxiety. In other words, this is called stress. How to come out of this stress? I think we have people who have gathered here for the whole day who can deliver better than me on this, and for that we have reached here. So to manage people, you have to manage your mind and you have to keep your spirits high. To keep the spirits high, today's session will enrich us with some knowledge so that when we leave this hall in the evening at 5:30, we get enough strength to handle our mind and talk to our mind, because mind keeps talking to us, but we need to make it reverse. I need to dictate terms to the mind. Mind can't dictate terms to me. On the lighter vein, I'll take another minute to explain because there are so many youngsters sitting here. Most of us think that we are putting on weight and we need to do exercise. And one fine day, you take a call that tomorrow morning I'll get up at 5 o'clock and go for morning walk at gym. How many of you feel this? Be honest, don't worry. And when you get this thought, there are three categories in this: a graduate, a postgraduate, and a doctorate degree holder. A graduate is one who says, coming Monday onwards, I'll be disciplined. And a postgraduate says, coming first onwards, I'll be disciplined. And a doctorate degree holder says, New Year resolution. And whatever it is, my friend Sancheti is here, I can take his name. Sancheti takes the decision to be disciplined from tomorrow morning. He puts an alarm in the night and he sleeps. And when he sleeps, you know what? He's content. He's so happy because he's taken a decision to be disciplined from tomorrow morning, and he sleeps. Unfortunately, there's some unknown energy called God. You can call it Allah, Ram, Rahim, Jesus. God is innocent, man is intelligent. And the innocent God refuses to sleep all through the night because Sancheti has taken a decision to get up at 5 a.m. and at 4:45 or 4:50, God wakes him up. Yes or no? Have you experienced this in life? And the moment he gets up, he looks at the clock and says, 10 more minutes, and he sleeps. And at 5 when the alarm rings, Sancheti says, not today, tomorrow. In the night when he was sleeping, he dictated terms to the mind, and in the morning, mind dictated terms to him. Next half an hour, he'll toss on the bed, and later on, 23 and a half hours, there's a sense of guilt and regret that I should have got up and gone for morning walk. And to come out of that guilt and regret, we have eminent people here to help us today and to learn the techniques to come out of it. And to follow ethics in business, we need to be free from stress. That is also which they are going to help us. And at the end of the day, I guarantee you, all of us will have, rather I'll put it this way, the signs of a good leader is purity of heart, clarity in mind, and sincerity in your action. And this is what we are going to achieve by this evening, and I guarantee you and promise you. And last but not the least, I am grateful to my colleague, Mr. Shekhar Agarwal, who is our chair for this event, for organizing such a wonderful event for today. Thank you.
Thank you, sir, for the inspiring welcome and for setting the content for today's important theme. We would like to now play the FTCCI film.
Hyderabad, a confluence of cultures, a bridge between tradition and modernity, and a city with a timeless allure. While the world grappled with conflict in 1917, a pivotal moment quietly unfolded here. A group of visionary leaders came together to form the Deccan Chamber of Commerce, which began as a spark but went on to shape the destiny of an entire region. With a legacy spanning over a century, this institution is now known as the Federation of Telangana Chamber of Commerce and Industry, FTCCI. FTCCI has become the cornerstone of industrial and economic progress of Hyderabad, which has emerged as a global hub for information technology, pharmaceuticals, aerospace, and other key industries. FTCCI champions a pro-business ecosystem not just in Telangana, but across the nation. It addresses the real-time needs of direct and indirect members through expert committees led by seasoned professionals. FTCCI contributes to state-level advisory committees, publishes white papers and journals, and provides research that drives decision-making. Its Skill Development Center conducts programs that empower both individuals and industries. FTCCI has adopted 15 government ITIs to ensure that Telangana's workforce remains competitive and work-ready through bridging skill gaps. The services of FTCCI include issuing of Certificate of Origin, visa recommendation letters for business travel, consultancy services in GST compliances, and guidance for aspiring entrepreneurs. It also enables global collaboration that positions Telangana as a happening business destination. Each year, FTCCI honors outstanding business achievements through its annual Excellence Awards that span 20 categories, including HR Excellence. These accolades recognize innovation, resilience, and best practices that motivate industries to strive for greater impact and growth. FTCCI invites you to be part of a dynamic, trailblazing organization. Join the movement to ignite entrepreneurial spirit, empower businesses, and drive India towards self-reliance. The future is ours to shape. Let's realize it together.
That was a few glimpses about FTCCI. Now I invite Shri Shekhar Agarwal, Chairman of Healthcare Committee, FTCCI, to deliver the introductory note. Thank you.
Our guest of honors, former National President, Indian Medical Association, Dr. Dilip ji, President, Indian Medical Association, Telangana, Dr. Keshav ji, our visionary President, Ravi ji, Senior Vice President, Maheshwari ji, Vice President, Shrivas ji, Eminent Psychiatrist, Dr. Keshav ji, Dr. Baijesh ji, Co-Chair Healthcare, Shiv Rungta ji, Senior Cardiac Surgeon, Dr. Anand ji, Vascular Surgeon, Dr. Rahul ji, my colleagues from the Federation, and friends, a very good morning to all of you. Friends, first of all, I'd like to congratulate all of you for being here and also your decision to invest your one-day time for and on your own mind, which is going to work till your last breath. Can we acknowledge your presence here with an applause? And with a gentle smile too. We are deeply grateful to our guests of honor and eminent speakers who are going to teach and train us on resilient minds, thriving businesses, psychology to elevate life and businesses to new heights. They believe in मन ही देवता, मन ही ईश्वर, मन से बड़ा न कोई. Your mind is the creator of your world. I repeat, your mind is the creator of your world. Can we acknowledge their presence here with a round of applause? Thank you very much, sir, for being here this morning and looking forward to learn a lot from you. Friends, today is a life and business transformation day for us. Each and every part of our body is important, but the most important is our mind. Our president, Raviji, believes that mastering your mind is mastering your life. Now, everything in this world we do with our mind. Our thoughts, our emotions, our response to people and situations without any formal training, without any formal education, and without any manual on mind, simply by trial and errors. A small couplet. खुदा को कर बुलंदी इतनी कि हर तकदीर से पहले खुदा बंदे से पूछे क्या तेरी रजा क्या है, तेरी रजा क्या है. Your destiny would follow you if your mind is right. Very, very important, your mind must be right. It is said that more than 95% of the diseases are psychosomatic diseases related with our mind, let it be high blood pressure, diabetes, etc. There are many mental diseases which are increasing like dementia, etc. Today is a unique opportunity to experience a special psychometric test to know more about yourself, learn about your own psychology, practical psychology, learn more about your mind, your thoughts, your emotions, your response to people, your response to the situation with the help of the distinguished psychiatrists and management leaders from ISB, IP, and IIT IM alumni. You also learn practical psychology of others to help to establish better harmony at home and workplace to create performing teams. We would also learn the consumer and competitor psychology. Friends, just be relaxed, be smiling, enjoy your learning, see what couple of benefits you can have or you can derive from each speaker, and also keep sharing your benefits to your other participant during the tea break and lunch break. Friends, how many of us here are ladies and homemakers? We find quite a few homemakers and ladies, okay? So many times you find that your husband comes back from office not in very good mood. As a housewife, by today evening, you would be equipped, you can become a good consultant, you can become a good advisor. Just what you have to do is, evening, the time your husband comes back, offer him a hot cup of coffee, ask whether he had challenge with his team or any customer issue or any competitor issues. They are the major issues. And by the evening, you will be trained in all these things and you would be able to solve 90% of your husband's problem. For making body strong, people go to gymnasium, but we skip the most important workout, which is working on your own mind. Each and every session is very thoughtfully designed for your benefit. 5 o'clock, the time you come out, you would be very happy with your learnings and your life would certainly be at a much higher level. So that's a guarantee from our President and the Federation. All the best and enjoy your day. Thank you very much.
Thank you, sir, for the insightful introduction and for highlighting the significance of psychology as well as for the well-being of the business leadership. It is my privilege to invite our esteemed guest of honor, Dr. P. Keshav, President, Indian Medical Association, Telangana, to address the gathering.
Respected Dr. Sri Ravi Kumar ji, President, Federation of Telangana, FTCCI, and today's chief guest, Dr. Dilip Banishali, National President, my mentor, and Chair of Healthcare, Shekhar Agarwal ji, Senior Vice President, K.K. Maheshwar ji, and Srinivas Garimla, and today's celebrities, Dr. Keshav and Baijesh, good friends of psychiatry. Here I came the guest of honor as the President of Indian Medical Association, Telangana State. Incidentally, I'm a psychiatrist, practicing since more than 3 decades. I'm very happy today because one is institute is more than 100 years, and I used to share my insights about the today's topic: resilience, science of resilience, science of wisdom, science of yoga and spirituality, from masses to the researchers. And I invited by American Psychiatrist Association next May 16th, coming 16th at San Francisco, to do workshop on wellness therapies, where I practice. I'm having a wellness clinic in my hospital. But by seeing the here delegates, a wonderful cream of the society, is very appropriate to talk about this topic. If you talk with the masses, they cannot understand. They are not having psychological mindedness or spiritual mindedness, and they are having their own basic needs problems. And researchers, we live in a different world. But here, the people really, whatever we tell, will go to the real practical implementation by you people. I think you came here to learn and implement in your life. This is a real target audience. What we call is target audience, and Keshav and Baijesh are lucky enough to train you and about the theme. Coming to the today's topic, the science of resilience, science of wisdom. Now, this is the era of science. When mind is a miracle to understand, even though we are living with the mind only. Now, these sciences develop, and because of this, you are able to understand the life and mind, because every 10 years your mind changes. And to understand the meaning and purpose of life, the neuroscience of wisdom and resilience is necessary. And to understand the flow of thinking, how to prevent the mind from the brittleness, easily fragments. And not to make it fragmented, you should have a resilience. It's not like iron, it's like plastic. You have to adjust to the life challenges. As your life is changing into different with the time, and you are also changing with the time, and your life will changes, your experience changes, your thinking, and these are all the important how to improve the resilience and how to live. Dilip Jesse is a proud son of Bombay, produced tons of literature in California University. He migrated from Bombay to California, and he became first president of American Psychiatrist Association of Indian origin. He developed lot of tons of literature. You just Dilip just say wisdom. You will get lot of wisdom science. He localized the centers of the brain, which are centers of wisdom. And I don't want to go deeply about this. And coming to, and he is now proposing 120 years of life is possible with good quality of life and wellness. Now the health, because we are the leaders of IMA, and presently India is taking big role in the world politics, like Modi and everything. And today's Dilip Manishala sir is the Indian Medical Association President. Today's American Medical Association President is Bobby Mukkamala, is from Rajahmundry area. So this is a change in the world is happening. And world is seeing to India to about Indian module of mind. Our Sanatana Dharma tells, everybody knows Vishnu sleeps on Vasuki, no? On the milk ocean, he sleeps in the Vasuki. Is it possible to sleep on the snake? So this is a module given by our rishis. The Vishnu is a symbolic of the self. We are today is concentrating on mind. There is something different than mind, that is I. Self is different, mind is different. I will touch it in next after 2 minutes. Shesha Shayana Vishnu is a module where the Vishnu, the self, is sleeping on snake. Snake is Vasuki, is a Nagu. It always moves. Nagu means Na plus Agu, which is non-stoppable is a Nagu in Sanskrit. You cannot stop it. It goes to Washington, now it went to San Francisco, it came to Hyderabad and go to Karimnagar. It moves always. And is comfortably sleeping on the snake and using the snake as a bed, comfortable bed. And he is making the snake as a beautiful umbrella to protect him. How to make the mind to protect you. How to make the mind, it will not sleep. You sleep on the bed, you will not get sleep, and mind is not sleeping. My patient will come and say, my mind is not sleeping. So how to make the mind to control? So what is the secret of Vishnu? Vishnu Vahana is the Garuda, is eagles. You need eagle's vision to see check the snake. The snake becomes statue because the secret is when Vishnu is sleeping, the opposite is Garuda is standing there. If there is a Garuda, the eagle, snake becomes a statue. So what is the message is, how to observe the mind, that is the science of yoga of Indian rishis, munis, who practices Mauna, became Mauni and Muni. He becomes the rishis, right way of seeing, seers, how to see, which is already seen in your life, the mind. So you will know the cleverness of seeing, which can be taught in India only. So now the world is seeing about this, and this is where various types of yoga and meditation are there to do this. And I will tell few words only. Chidambara Rahasya, one word. Tripura Rahasya is second word. Sandhya Vandanam is third word. Then yoga, and my special area is yoga and spirituality. There is a mantra yoga. There is a Gayatri mantra and Mrityunjaya mantra. If you ask anybody, scholar, who is the greatest mantra in Indian philosophy, is the Gayatri. What is the second greatest mantra is the Mrityunjaya mantra. I presented a paper using Gayatri mantra for psychotic disorders, reality problems. I am using the Mrityunjaya mantra for mood disorders. I go to depression, attachment problem with the negative thoughts, negative emotion, go to depression. Positive thought, positive attachment is the manic moods, swings. Both are equal to Mrityu. That's why Shiva mantra is the second mantra, which is a destruction of attachment. This is a destroyer of attachment, is a Shiva. Then the Amma mantra, is the mother mantra, is a Gayatri. So first mantra is a Gayatri. You would remember that female is powerful than the male psychologically. And I don't want to go deeply, and controversy should not come. And they are bosses of the house. And this is invented by rishis who became failure in the life and wife, not able to control. They went to sannyasa and did research. They kept everything in Talapatra Ganda. That was divided into 4 Vedas. And Brahma Sutras came, and then Bhagavad Gita came, Upanishads came from all the literature. that was declassified into by Vyasa. So this here, to go to mantra is mananam trayate iti mantraha. So if you if you understand that and practice, you will be protected, whatever the thing. Then second is yantra. Mantra, yantra, tantra is there. Yantra means mechanical power of the mantra. I don't want to go to that. To describe it takes 10 minutes. My time is only 10 minutes. So mechanical, there is a phonetics in the mantra. All Gayatri 24 letters are labials. Labials, not come to the throat. The Mrityunjaya mantra comes from end of the tongue to the tip of the tongue. But this is the phonetics of mantra. There is a mechanical power of mantra is there. It massages, Mrityunjaya mantra massages the limbic system. The Gayatri mantra massages the frontal lobes where executive power, executive functioning, and your cognitive functioning will be excellence with the Gayatri. The procedure is a tantra. The procedure is a Sandhya Vandana, Udaya Sandhya, Madhyana Sandhya, Santra. We mistaken that the sun is a god. Sun is not god, is after god, after planet. So we pray the morning sky, afternoon sky and evening sky. Why we pray the sky? Sky is the ambara, that is space. So this is about 250 GB cell phone. It is powerful than the 100 GB cell phone. If you feed more than something, I'm sorry, there is no space, you have to purchase it. You are connected in the morning and afternoon and evening with the infinite space. That means this is the Chidambara Rasya. Chit means mind, Ambara means sky. Your Chidakasha should be extended to infinite Akasha. That I learned from Amit Goswami, the quantum physicist from New York, who migrated from Calcutta, from Orthodox family. He researched that Akasha Tattva, that we have to increase the space of the mind, then your GB will be improved to the infinity, then you are the master of the mind. So if you cook up everything in the pot, that pot will become broken. So actually we have to break our pot at the end of the life, in the funerals. But people will fill in the limited space, your mind will be broken, and we do the business on the confused minds. So to get clarity. So our rishis has already given a clarity, master clarity, and the MD degree of psychiatry is we are masters of the mind, we are physicians of the mind. We know how to disturb the mind. Now science developed a lot to understand our scripture and how to yoga is useful. And science is growing now to understand our rishis' knowledge. That is the special area where we are practicing. And coming to the closing of my address is the last 3 steps, dhyana, dharana, dhyana, samadhi, of last 3 steps of Patanjali Yoga. Dhyana, dharana, you are focusing on something that may be business or something, or controlling mind, or controlling your staff, or something else. So you are focusing on that, you are meditating at that, that is dhyana, is meditating, repeating all possibilities, then you are reaching the goal, that is the samadhi. So this is the last principles of yoga, and with that, lot of things are there. A lot of meditation methods are there to practice how to control the mind. Now we developed, now science is developed and psychiatry science is developed how to do the mind. Like we know everything. Unfortunately, the science of medical science in India is mindless medical education. No medical doctor is trained about mind. We start physiology of the mind in the MD psychiatry. It is an unfortunate thing where US and UK, all Europe and Americans are reading their psychology, basics of mind from MBBS itself. So that we are changing now, the educations are now changing. Now we are developing in a position of manual of the mind. If you purchase a TV, if you purchase a vehicle, you will get a manual of the vehicle and you know how to operate it. Now we have to develop a manual to mind, how to control, how it works in physiologically, normally, how it works with psychopathology and with how it disturbs, how to control the mind, that with the science of wellness now and science of wisdom now, science of resilience, which cannot be breakable easily. This is the message. I think this science has given by Yogeshwara, that is master of drama, that is Nataraja is Shiva. Actually yoga science is given from Shiva to Patanjali, Patanjali is given to us. Even Gayatri Mantra is given by Rishi Vishwamitra. So because he is also having his own problem and he invented the Gayatri to develop himself and has given to the world to practice. And Mrityunjaya mantra also again given by Markandeya, but it also given to Shiva, by Shiva to Shukracharya, then came to the Markandeya practiced it and how to practice that. They became Chiranjeevi, that is the thing. So these are all the modules to become master of mind, to master of your life, and where you should not become the victim of mind, a victim of life drama. You become master of life drama, then you can do wonderful business. You can help the country, you can help the global business, you can become, and with a local Kalyana mode. Thank you very much.
Thank you very much, sir, for your enlightening addressing and for emphasizing the importance of resilience in professional life. And sir himself is an eminent psychiatrist, so we have a lot of inputs from him now. So may I now invite our distinguished guest of honor, Dr. Dilip P. Bhanushali ji, National President, Indian Medical Association 2024-25, distinguished medical professional and leader to deliver his special address. Over to you, sir.
Namaskar. A very good morning. डॉक्टर किशन का इतना जोरदार जो इन्होंने आज का जो भाषण शुरू किया है, I don't know if you people are confused or you are really entertained. The vast knowledge what he has got about yoga and but I'm sure a lot of you are confused about that also. So I'm sure in the next session, coming afternoon session, we will get more enlightened on this with the various speakers who are here today. My special thanks to the President, Dr. Ravi Kumar ji, for getting me here. Dr. Shekhar Agarwal, which I have known for many years. Dr. Maheshwari, Mr. Maheshwari, Mr. Srinivas, the Vice Presidents. Members of this esteemed organization, I bring a warm greetings from members of Indian Medical Association, the largest body in the world. We are 4.5 lakh members throughout the country with 32 branches and 32 state branches and 1800 branches throughout the country. So this is the biggest medical network in the world right now. Now, before I go into this resilience matter, Indian Medical Association has played a vital role, not only for the causes of doctors, but the society in general. Now, I would like to enumerate few things which are, in this last 1 year we have done it. Yesterday only, today in fact, our Prime Minister is going to inaugurate that HPV vaccination program. Now, this was an initiative which was taken by the Indian Medical Association. Last year we had an MOU signed with the Federation of Gynec Society, where we promised to train 50,000 of our doctors, IMA doctors throughout the country. And that we were successful. Now you'll ask why this training to doctors. Now this SPV vaccination program, it has been found that the children between the age of 9 and 14, if they are given this vaccination, 98% chances that the cancer cervix can be stopped. This is a very important message which we want to convey today. The main purpose why I'm saying this is because you should see this, your children are getting vaccinated. Now that the government, because we have been writing to the government since 2019, that this program should be included in the national immunization program. Now the government is going to give. It has already, I think, Prime Minister must have through Ajmer that he's going to start this program. Now IMA has been in forefront to propagate this thing of HPV vaccination. We have trained almost 30,000 doctors up till now. Now why training? Because it's important about this vaccination is when to be given, whom to be given, what are the drawbacks, what are the advantages. This has to be explained to the parents. And that's what was the training for the doctors. Now that it has come in general public, I'm sure it will going to benefit our country people. The second important thing IMA done was, IMA had adopted almost 2,000 villages under a program called Aao Gaon Chale. Now in this program we have adopted 2,000 villages, wherein not only we give medical aid, but in general also about the nutrition, about the environment, about safe drinking water, lifestyle management. This has been going on. We have adopted 2,000 villages and we are trying to adopt more villages. IMA has played a very bigger role in this, in not only government programs like we did for Pulse Polio, we did it for COVID-19 recently, and you people should know the sacrifices the doctor has given during COVID-19. We lost almost 2,000 of our doctors in this COVID-19. So the role of IMA in this was a bigger one. The third important was, I think now that your people are from the industry, about GST. IMA was after the government to reduce the prices of common drugs, especially cancer drugs. And the common drugs, we had gave a list of almost 200 drugs to the commission, GST commission. I met 3 times the commission, went to the commissioner of GST, and ultimately they could do it, and IMA has a role in that. So people should understand the role of IMA. I'm really thankful that bringing this matter to, well, it's really an honor to be today to talk about something that is at the heart of every successful entrepreneur and leader, that is called resilience. As a doctor and as a leader, I have firsthand how mental toughness make or break a business. Now, resilience is just about bouncing back. It is about bouncing forward. It is about turning challenges into opportunities and emerging stronger. An entrepreneur and leaders, you face countless hurdles, market fluctuations, team dynamics, regulatory changes, but it is how you respond to that defines your journey. Now, psychology plays a vital role here, understanding your mind, managing stress, and fostering a growth mindset can elevate both your life and business. And for this, there are few takeaways. Embrace uncertainty. The business landscape is unpredictable. Adaptability is a superpower. Prioritize mental health. A healthy mind fuels creativity and decision making time for self-care. Build a support network. Surround yourself with people who will uplift and challenge you. Learn from failures. Every setback is a lesson. Analyze, adjust, and move forward. As leaders, you set the tone of your teams, foster a culture of resilience, empathy, and innovation. Encourage open conversations about mental health and support of each other's growth. Now, to thrive in business, you need to thrive in life. By cultivating resilient minds, we can build not just a successful businessman, but also more compassionate and substantial communities. I've been telling all this, tours throughout the country, which I did last year. We said, in fact, of so many hurdles doctors face. You people sitting here must not be understanding the difficulties doctors have gone through. The amount of hurdles, the amount of problems doctors are facing, not about Consumer Protection Act, about Clinical Establishment Act, about Violence Against Doctors Act, and quackery against mixopathy, is innumerable. And we have been, as IMA has been fighting with the government. In fact, what we have seen is we don't have support neither from the bureaucrats, neither from the politicians, neither from the judiciary. 3 to 4 cases are still going on to the Supreme Court. In fact, the Consumer Protection Act, where it said the judges and the lawyers can be out of the preview of Consumer Protection Act, we challenged it that why not doctors? Unfortunately, the 3-bench judge threw over that application. Now, recently, once again, Supreme Court has taken over. We are fighting over this. Hopefully, with this time, we should get some positive result from this. Similarly, about Clinical Establishment Act. There are 32 agencies where we have to take permission to start a nursing home. Can you imagine? Now, a small nursing home or a husband-wife running a nursing home, say 30, 40 years back, if you are putting them so many hurdles in their practice, like you should have so many meters surrounding your clinic, the wastage should be done, 101 problems are there. So we asked the government to take out these regulations out of the 30, 40 bed hospitals. Almost 8 to 9 states throughout the country they have taken out. We are fighting in Telangana also. I met few times with the health minister here also to see that this comes out. Now what, as a lay people or as a public, you should understand that doctors, as you people are called doctor next to God, we are not God. That should be absolutely clear. We are also human beings. We have our own problems. We have our this thing. So what we give to the society is absolutely unmatchable. That can be not be measured in any amount or any such thing. That we have shown it during the COVID time. As I said, we lost over 2,000 doctors in this. I'm not here to talk more about what doctors this thing. I'm glad this federation has taken a very important subject of resilience and how to cope about this. I'm sure these deliberations, you people will be enlightened. I wish all of you best of luck. Thank you very much for calling me.
Thank you, sir, for your motivating and thought-provoking address. May I request Shri Srinivas Karimala ji to present a memento to Dr. P. Kishan ji as a token of our gratitude and I request Shri Shivakumar Rungta ji to present a memento to Dr. Dilip P. Banishali. Thank you to all the guests and the dignitaries for this introduction session. Now we'll be starting with our technical session with Dr. Baijesh and Dr. Keshav Rao. So both of them would be taking the first half of the session till 1 o'clock before lunch. Thank you very much. Please come, sir.
Hello, good morning everyone. Yeah, so we go with the introduction of speakers without much time. So I have put a slide. This is me. So I am a psychiatrist basically, and then is Baijesh, Mr. Baijesh, and he is a clinical psychologist, right? So can you put the slide introducing the Baijesh? Okay. No. Okay. Yeah. You want to introduce about yourself?
Yeah. Good morning, everyone. It's a privilege to be here and good to meet everyone. And thank you for the invite to FTCCI. And I was introduced to Shekharji by Dr. Keshav sir. And I'm a clinical psychologist by profession. It's been almost 13 years being a clinical psychologist. I have worked in, we are trained as a generalists, like working with children to old age people, so everyone. I worked in hospitals, universities as assistant professor earlier, with schools, with communities, with organizations, and wide areas of walks of life. Last 8 years I've shifted to working mostly with organizations. Organizations, they have, especially, when we are dealing with people, there are challenges, and working with conflicts and increasing the productivity, managing the people, employee wellness, I work with different kind of organizations. There are people who are into sports professions, like there are cricketers who are playing in IPL, or athletes, or there are petroleum companies in Qatar where there is a conflict within the family on how to manage the organization well, or how do we increase the productivity. So there are a wide variety of challenges that I work with organizations. I work with a university based out of California, which is Minerva University, as a mental health advisor. And then I work with a training institute that's based in Singapore, Association of Solution Focused Training. So currently, as a freelancer, I'm still based out of India, but I travel when necessary. Yeah, that's a little bit about me. And
okay. Thank you, Baijesh. I will introduce a bit more about myself. I don't know whether you have gone through the slide or not. So I did my MBBS and then MD Psychiatry, and then I worked in Institute of Mental Health, what we call Eragada Hospital, for a few years, and then I moved to UK and I did my MRC Psych, and then I returned back to India, but I keep going to UK every year for 4 or 5 months, and I work as a child psychiatrist there. So basically I am a general psychiatrist and also a child psychiatrist. So this background will help you to understand more about me. And next, coming back to the topic itself, how we came here. So it so happened, Shekharji one day called me and said, we are arranging this kind of talk, and can you give the talk? So I was very pleasantly surprised, because he gave us the honor, I think probably I am right, to be the first psychiatrist to address in 100 years of time, because you are 100-year-old, right? So much about mental health importance in our country, right? So mental health has been the most neglected subject in our country, though it is very important. So since I worked in UK and I see the patients there, I will tell you that their knowledge of psychology, mental health, is more than our MBBS doctors here. I am not exaggerating. That is average person. I am not talking about well-educated English people. Average English person knows more than our MBBS doctor. They know about depression, anxiety, psychological treatments. Why is this happening? I wondered why. One of the main reasons is they got A levels. A levels is like our intermediate. Unlike our MPC, BIPC, they can choose wide variety of topics. They can choose 6 topics, 8 topics, and then they can become whatever subject. So their kind of entry into different subjects is also very high. Ours are very restricted. If you do commerce, you go into only BCom, BA. It's not like that. So everyone does psychology as an optional subject, because psychology is important for any subject, whether you do medicine, whether you do engineering, or whether you do business studies, whatever. Particularly for business and people who are dealing with other people, leaders, it is much more important. So that is where I think today we are, right? We have given total today 3 hours for kind of medical people, right? And probably after afternoon, after lunch, you have got another 3 hours where the speakers will talk about more business related psychology. So since we are given this opportunity, I thought, and actually Shekharji has spent quite a lot of time kind of deciding topics. Really, I was surprised at his interest and enthusiasm. Team also, sir, team also. But you are the contact point. Yeah. So then we have put up. So what is that you should know from this, right? Because he is a psychologist and I am a psychiatrist. And as a psychiatrist, I deal with mental health problems and we treat with medication. And as a psychologist, he does a lot of assessments, and both of us do the diagnosis, but he does the psychotherapy kind of treatment. So we are two different, and we came together and put up this one, right? And in this, what we thought, usually when we go to talks, the first what we understand is people don't know the difference between a psychiatrist, psychologist, clinical psychologist or something. So we put up a first slide is about know the mental health professionals, right? I'm sorry that there are definitely a lot of well-educated, well-known people here, group is very diverse, I understand. They may get little bit bored, but I have to assume when you talk to the person who understands least. So that would be the general principle, right? Can I have the first slide? We can do that slide. Oh, right. Yeah, know the specialist. So I will talk about psychiatrists and I leave it to Baijesh, the rest of the thing. So psychiatrists are usually, they are MBBS doctors, and then they do MD 3 years or diploma 2 years. Nowadays it's mostly MDs, and we will be trained mainly in the mental health hospitals like Erragadda Hospital or some Usmania Hospital. So that is what a psychiatrist is made up of. We treat mainly with the medications, but psychiatrists also can give psychotherapy, but because of the shortage of psychiatrists, they were mostly restricted to medical treatments, but nowadays the numbers have increased so much, they are also taking up therapies. And coming to clinical psychologists, Baijesh.
Clinical psychologists are those who are trained in psychology specifically. So we study about the mental health, the way how our mind works, the emotions, the interaction with world outside, the interpersonal space, and all these factors contribute to one's own mental health and even mental health challenges. So MSc Psychology or MA Psychology, that's like a 5-year program after the 12th, and then post that we have a specialization which is a licensed program run by the Rehabilitation Council of India, that's MPhil in Clinical Psychology, and then there is also a PsyD program that's recently introduced. So this is a requirement for being a licensed clinical psychologist to practice in India, and we are very less in number. So we are about less than 5,000 in India at this point in time. So there's a lot of effort from the governments and RCISF side to increase the number of professionals, qualified professionals. Now that is a gap that we see, that we have less number of psychiatrists and psychologists required for the people in terms of ratio, and that also we also have other professionals like psychologists and counseling psychologists. Now, the counseling psychologists or the psychologists are those who have completed the postgraduate in psychology. As per the current norm, it is like we need to have a master's to qualify as a psychologist, and they get a registration with the Allied Health Council, the new one. So, a psychiatrist, a clinical psychologist, a counseling psychologist, or a psychologist. Then we also have master's level psychologists who are specialized in organizational psychology. They specifically work with organizations. There are people working in health psychology sector, people working in research sector. So different applied aspects of psychology at a master's level, they specialize. Some of them are sports psychologists. So then we have certified counselors and people who are probably delegating the work to certified professionals. They do diploma or postgraduate diploma in counseling psychology after the undergraduate program. They're also working in many schools and other places like school counselors with this specialized training. Now currently, based on the new norms, I think only the master's level psychologists are qualified to practice. Yeah. And there's a lot of
we have to go quickly. Yeah, we don't have so much
and
time.
Also to say that you need to check whom you are approaching, because there are a lot of quacks, unqualified professionals in the field. A lot of motivational speakers will come and talk to you for 1 hour and make you feel aha, but they're not trained in the basic way in which how to work with people with challenges. So please check their qualification before you go to a psychologist or a psychiatrist.
Right. Thank you, Baijesh. Right. Coming to mental health, unlike in physical health, it's not as easy as physical health. In physical health, you have a clear symptom, pain, and when the doctor looks into it, he finds something wrong. But it is in mental health, what is normal itself is difficult to define. So it is a much debated topic. The one thing is, if you have a statistical concept, like suppose 100 people are there and 90 people behave in one way and 10 people behave differently, so these 10 people become abnormal, right? Say for example, someone from USA, in USA people talk very loud and they laugh all the time, and whereas in our Indian people we are kind of more reserved, we talk less, and we behave differently. So someone from India in USA may be seen as kind of introvert or reserved or something, or even depressed also, right? So so there is a lot of this loading is there, this social context and all these things. And then another thing is the culture and social influence. A lot of this mental health diagnoses are influenced by the societal this thing. For example, homosexuality was considered a mental illness. It was classified under a mental illness about 30 years ago. But now, and there were specific treatments available for homosexuality. But now it is no more an illness, and about 5-10 years ago, a psychologist offered treatment for someone who wanted to change his sexual orientation. He was homosexual and he wanted that to change. And that person was castigated, and there was a lot of attacks on him that he should be removed from his psychology practice. So that is how things can change. So the cultural context of this definition of mental illness. And usually in the psychiatry, we don't find kind of identifiable brain pathology or something generally, but the symptoms are kind of in the behavior, a behavior which is affecting others or himself, or sometimes it can be kind of symptoms like anxiety the patient also experiences. But sometimes we do have symptoms like voices and those things also. So overall, what I want to impress is the diagnosis of mental health or psychiatric diagnoses are not as straightforward, and we have to use lot of this common kind of cultural sense also. You can't just jump into conclusion that it's like a blood pressure is high, so is hypertension. It's not like that. So that way we are less vulnerable to AI. AI cannot take away our jobs. That's what we are hoping. So WHO definition is not. It also looks at not just the normal health. It also looks at how the individual functions in the society and for himself, and it includes well-being, resilience, functionality, social connection, and not just absence of mental illness. So if someone is mentally healthy, means that he is having good resilience, he is getting on well with himself and with his fellow people, and is doing well in the society. Yeah. So we look into a broader classification of mental illnesses. So I cannot put all the conditions, but I made a broad classification because we have a shortage of time. So usually we use the word disorder, not mental illness, because a disorder means something is wrong. Usually an illness means that there is an identifiable problem, identifiable lesion or some pathology, or there are clear symptoms. But when you use the word disorder, it is much more broadly used and more acceptable. So for some conditions we use the term illness, but most conditions we use the word disorder. So I keep referring to disorder every time, right? And now we have the broad classification is first is organic. Organic means that there is an underlying pathology. So for example, the psychiatry illnesses are behavioral symptoms. There is some behavioral problem which is visible to the relatives or the person himself experiences. But organic means that there is a medical reason or pathology. For example, a brain tumor. A brain tumor can also produce symptoms very similar to mental illness. And epilepsy is one condition which can simulate any symptom depending on the area of the brain stimulated. It can produce any symptom. And similarly, some brain infections like encephalitis, they can produce symptoms which the person is suddenly behaving mad and all that, but he may have a brain infection. So the first thing why the psychiatrist usually sees is he is a medical background. The first job of psychiatrist is to exclude any underlying medical reason. So for that he may has to do some, depending on the necessity, some CT scan or MRI, or sometimes if the person is depressed, it may be because of an underlying thyroid problem, we may ask for thyroid test. So that usually the psychiatrist is the first point of contact for kind of any behavioral psychiatric symptoms. And then we have a group of disorders called psychotic disorders. Psychotic disorders are where the symptoms are much more severe. The person is obviously abnormal behavior for most people. Even if the normal people sees him, okay, there is something wrong. He is kind of talking too much, or jumping on the street, or dancing, or he is shouting, screaming. People you see on the sometimes see on the street, and then there is these people typically lack insight. In psychiatry, we keep using the word insight. Insight means the person usually understand, normal people understand that they have a problem and they need help. But a psychotic person, he doesn't see any problem with himself. He sees that I am fine, I have no problem, and he lacks insight. He doesn't see the need for treatment also. And the common examples of this are schizophrenia and bipolar. And we go to each condition little bit into each condition also. But schizophrenia, bipolar are the common examples. And then we have neurotic disorders. These are less severe mental health problems or mental disorders. In neurotic disorder, one of the most commonest is important is depression. Again, this person feels very low, and you hear quite a lot about depression, and we'll again go into that in some detail. And then we also have anxiety disorders, where anxiety is the main problem. The person experiences anxiety. Each one we go in detail again. And then there are psychosomatic disorders. Shekharji was referring to that the person because of his psychological problems, he will complain of body pains, other symptoms, physical symptoms. That is psychosomatic disorders. And here in these disorders, the person's insight is present. He knows that he has got a problem, he has got lots of symptoms, and he needs help, either he needs medication or therapy. So this is where the insight is present. That is the main distinguishing between psychotic disorders and what we call neurotic disorders. And then we have got personality disorders. Personality disorders, we go into some detail again. Here these people have problem with the way they behave. It is for them, they don't see any problem, but they are the most important from probably your point of view. Suppose if you are running a business and you have a difficult person in your office, the first thing you have to think in terms of is any personality problem, or he might have a severe personality problem which comes under personality disorder. Personality is a very important topic for anyone who is dealing with other people, right? Particularly for the business people. And then we have a lot of other miscellaneous mental health disorders like sleep. We also deal with sleep problems, sexual problems, and eating disorders, less common in India. And there are problems specific to childhood, and then there are problems of old age, particularly dementia. And there are conditions now which are coming more and more, like ADHD is being talked more about. Even adult ADHD also we are seeing more patients because they are studying, they are looking at internet, and they are self kind of doing that what called screening test, and they are saying I am coming positive on ADHD, do I have ADHD? They are coming to psychiatrists nowadays. And then there is another condition called autism and these things. So we go through these things very briefly, each one. And at any point you can probably we break after each 1-2 topics and you can ask questions, right? Is that sounds better? That is okay? Yeah, I talk about biological and you talk about psychological. Okay. So it is important we understand why, what causes, we got something here, I was looking there. Causation of mental illness. So we need to understand a little bit why these mental illnesses are caused. Because many people think that mental illnesses are caused by external factors, right? but it is not so. So what we actually have a biopsychosocial model. So there are some biological, which are body related causes, as well as psychosocial or psychological and social causes. So all these things contribute to development of mental illnesses. So coming to biological causes, so hereditary is very important. So most of the disorders, particularly the severe mental illness, 80% of the illness probably comes from hereditary reasons. But when you come into the neurotic disorders, it becomes less. Environment and other reasons also become equally important or sometimes more important also. So all mental illnesses should not be seen as only one, under only one spectrum. So the biological reasons, one is the hereditary I mentioned, the other is something to brain diseases, whether it is a degeneration of the brain or a tumor in the brain or infection in the brain or epilepsies, all these things cause mental illnesses. And then we also have, so in these conditions usually we can actually diagnose. If you do a CT scan, it may show some tumor. If you do some cerebrospinal fluid analysis or something, it may show infection. And that is when we call them organic mental illness, where there is a physical cause is there. But then in many of these things, though it is caused by brain abnormalities, for example, even illnesses like depression, schizophrenia, have brain problem, it won't show any kind of anything on the CT scan, right? It may not show anything. It is due to imbalance in the chemicals in the brain. The brain is soaked in lot of neurotransmitters. So an imbalance in that will cause these diseases to appear. So we have an indirect evidence that there is this thing, because when we use certain medications acting on certain neurotransmitters, we are seeing definite benefit. The evidence is not very direct, it is indirect, because we are using some particular medication which blocks dopamine, and there is improvement in the symptoms. So that means, it is something to do with that, but we don't know whether it is working directly or indirectly, but our present knowledge is limited to that. So brain chemical abnormalities are the major reason for these illnesses. And then there are psychosocial reasons. I request Baijesh to.
So we have, if a person is going through a difficult time, multiple reasons contribute to it. Now, if you look at, Devdas, the movie, right? Why was Devdas depressed? You can find a lot of interacting factors. What was his childhood like, and how he grew up to be. There was a relationship, there was a breakup, there's alcohol consumption, like increased substance use, and multiple factors contributed to him being in that depressed state. Now, there are, as said, generally there is a biological factor that could possibly contribute. There are also psychological factors and social factors, like how was this person's childhood to that rearing up was like, how was the parenting was like, and what kind of a childhood did this person have, what kind of traumas this person endured. All this contribute to this person's development. Like, is he generally fearful? Like anything that he approaches, there is a fear with which he is approaching, or is there a confidence? There is a lot of factors and life experiences that contributes and shapes this person's approach towards the world, and thus makes him vulnerable. Like certain coping systems and coping skills may be lesser. How do I handle interpersonal space? I may not have this necessary coping skills. So thus I'll become anxious when I'm in a social situation. So that I have a social anxiety. So there are psychological factors. There's also other factors like I have ongoing conflict with my partner, my spouse. Like there's a fight going on. That puts me at a very difficult space that I might eventually slip into a depressive space. And I may have already a biological vulnerability, possible, but also that every day, every other day, I have a conflict that's going on at my home, which makes my entire functioning very vulnerable. So the way I'm vulnerable could be due to different factors like the psychological factors, the social factors, other significant family dynamics, death of a closed one, And then it could be that my own perception of myself, like I feel that I'm becoming fat or I'm not looking good enough, and then I keep doing everything that would help me manage that, and it becomes problematic at some point in time. Now I hear in news that there's a person who got infected by something and passed away in my family, and I'm already generally anxious person. I start feeling that anywhere I touch there could be some contamination, so I start washing my hands again and again, and I start not going out, and there are challenges that way which comes up due to our psychological, social, in the interactional space, or all these spaces combined. So there is biopsychosocial factors. So generally a mental health condition is multifactorial, and we also know there are times when this is purely biological too, like as sir mentioned, what could contribute to it. Yeah.
Okay. Even the genetics also is not very straightforward. Like some genetic disorder, suppose a father has, there is a 50% chance that a child has, right? But the mental illnesses like schizophrenia, bipolar, they have a 80% probability, 80% loading heritability, but still that there is no, we have not identified a single gene, and we cannot say that this so many percentage will get. It's very difficult. It's not the environmental factors and hereditary factors, they both interact, and that's how someone has the problem. Right. Now there are other concepts. Basically we are introducing you the concepts. The concept of biopsychosocial model is one concept in understanding mental illness. The second concept is we also look at predisposing, precipitating and perpetuating factors. So I will give you an example. See, predisposing is something that person is more likely to develop that condition. For example, suppose I take an example of a 40-year-old man who developed severe depression, and he came into hospital for admission with suicidal ideas, right? This person has a family history of depression. That means he has got a predisposition. He is likely to get, the chances of getting depression in him is more than average person because there is a family history of depression, right? That is a predisposing factor. And then there is a precipitating factor. Precipitating factor is now recently he was kind of fired from his job. So he was not able to perform his work. So he was thrown out, or he fell out with this boss and he was thrown out. So that has actually precipitated. So he was having this predisposition all along, but now this has made it sudden, like the last straw, like. So that is precipitating factor usually we present. We always ask the question, why this person has developed this problem, why he has come to us now, though he has got this predisposition, these problems all along, what brought him to us today? So that is what we look at always. And then there is also perpetuating factor. For example, this person has a marital discord, their problem at home. So this person, it maintains, that is a maintaining kind of thing. So he has got a kind of predisposing, and there is something precipitated and something is maintaining. So all these factors are important in understanding a person's mental illness or mental health problems. So then there is another person called stress vulnerability hypothesis. This is very often people ask. So suppose I have got hereditary, do I automatically get that problem? No, it is not. I take the example of diabetes to make it easy to understand. So someone has a family history of diabetes, right? And then this person leads a very active, healthy lifestyle. He maintains his weight and he exercises, and the chances of his developing diabetes are less, right? He has got an average loading of the kind of family history of diabetes, but he is keeping himself fit, so the chances become less. If someone has got a very heavy loading of diabetes, very heavy loading, he is also keeping fit, but he will still develop because genetic loading is very high. And so there is, and similarly someone has got a very low genetic vulnerability for diabetes, but he is leading very unhealthy lifestyle, made himself overweight, eating lot of whatever sugars, not exercising, then though he doesn't have a vulnerability, he can still develop diabetes. So there is what we use in the mental health, we use stress vulnerability. So the stress can make a vulnerable person develop mental health problems. Whereas if there is a stress is low, the chances of developing are less, even though he has got predisposition, hereditary background is there, but he is having no stress, then he may not develop a kind of full blown illness. So the stress and vulnerability interact to present with mental illness. So we have to understand this importance of reducing the stress is very important. Vulnerability we can't change. If you have got the genes, we can't change it. We can't choose our parents, as you say, right? Okay. So next we go to the next one. Is again we are going into a broad understanding of what kind of treatments the psychiatrists or psychologists will give. Word about diagnosis. Usually the mental health, the psychiatric diagnosis are based on history and blood tests. A detailed history will be taken. Usually first time at least half an hour to 40 minutes the history taking will be there. And then if we suspect any problem, suppose if someone has developed very short time, they say that only since yesterday this person is behaving very abnormal, talking mad, irrelevant, all that, only one day. So then naturally we think, okay, then we think in terms of something happened, like any infection in the brain or what happened. First thing we go to is about some organic. But if the person, they say from last 4 years he is withdrawn, slowly he has come to this stage now, he is suspicious, then 4-year history. Suppose if there is some the tumor won't sit idle for 4 years, then we don't do much investigations. So it is the psychiatrist who decides how much to investigate at the first instance. And then coming to treatment, for any mental health problem, there will be a pharmacological treatment, there will be psychological treatment, combination of both, right? And so I talk about the pharmacological treatment. We have a huge range of medications now, right? And it was in first time in 1957 the antidepressant chlorpromazine was introduced. So before chlorpromazine there were 150,000 beds in England, and then now it is reduced to 15,000. After the advent of chlorpromazine, all these people, when it was tried, they improved to a degree that they no longer needed to be kept in asylum. So all these asylums in UK which had 2,000, 3,000 beds, they were all closed. Now you have small units of 20 patients, 30 patients. When they are very severely ill, they manage and they will send back. Right. So this is the contribution of chlorpromazine. Many people say that psychiatric medications are not good, they should be avoided at any cost. That concept is wrong. And we also choose the medication depending on the condition. There are some conditions which, like severe mental illnesses, where the medication is first choice. And there are conditions like anxiety disorders where psychological therapies are the first choice. And when they don't respond, we go for medication. But for severe like schizophrenia, bipolar, so kind of quite mad people like, and medication is the first choice. And if psychological treatments also help them to feel better, first choice is medication. So we also take the patient preference also into consideration. For some conditions like depression, moderate, not severe, not mild, we say okay, the patient says no, I don't want to take medication. So, okay, you try the psychological treatment first, and if it doesn't work, you come. And then there are like totally, some person says no, I want only medication. Okay, that is his choice. So patient choice will be always taken into consideration. And there are some treatments like in psychiatry, like ECT, electroconvulsive or shock treatment, what people call. which is usually in movies it is shown it as kind of barbaric treatment, but it is not so. It is done under anesthesia. It works very well, but it is reserved for very severe conditions like ECT treatment. Fortunately, we have developed now another thing called RTMS. This is an outpatient. There is no shock or anything, no seizures, anything. So RTMS is like a magnetic stimulation, but it becomes more expensive. They have to take 30 sessions something, and each session costs 2,000. So that's also now available. So these are what we call as physical treatment. So there are pharmacological treatment, there are physical treatments, and there are psychological treatment. Baijesh, can you elaborate on?
So as we discussed earlier, there are various reasons why a person develops a psychological condition. There are various psychological, different approaches to treat mental health conditions. Now there are very popular one is called cognitive behavior therapy. They address working with your thoughts. Now a person's challenge may be coming because this person constantly thinks that I'm useless, I'm helpless, nobody understands me. Now there are challenges how we can address this particular person's mental health condition, but this therapy we look at how do we change the relationship this person has with his thoughts. Is he taking it way too seriously that it affects their day-to-day functioning? Or is there any other way in which we can work? The same way, their response to situations. Like for instance, if I'm angry, I can respond to a situation differently. Like I'm angry, I can take a knife and stab the other person. Or I'm angry, I can punch the nose of the other person. Or I can yell at that person. Or I can tell them that what you did made me really angry. I don't want you to repeat this. I can stand up for myself or be assertive, or I can just dump it in myself, in my mind, and not respond to it, and over a period of time it kind of builds up and becomes problematic. So in therapy we work with how do we regulate these emotions, how do we appropriately express this. So different kind of psychological therapies, like there are 100 to 200 different types of therapies available, like CBT, acceptance commitment therapy, psychodynamic therapy. So all of them work with this thought patterns, your emotions, your behavior or your interaction with the world, and building your coping skills, your resilience skills, and how do we develop these skills to address these challenges. Like for example, when this person comes to you, comes in front of you, you feel so angry, how do you respond to that person next time so that it doesn't become very dysfunctional, right? So things like that. So that's where psychotherapy comes into effect. Now for instance, if it is depression or anxiety, these kind of challenges, anxiety is when I'm really worried about what would happen in my future, how do I address the situation. You kind of support, this therapy supports and gives them ways in which how they can address the situation. It works with a person with low mood to elevate their mood and regulate their mood when that person is depressed, using psychological means, like techniques, like homeworks, like they work with the thoughts, you work with the emotions, like that. Yeah.
Thank you, Baijesh. And I want to add word about cognitive behavior therapy, which I already mentioned. Cognitive behavior therapy has developed over last how many years? 40 years?
50 years.
40, 50 years, 1960s, I think, Aaron Beck. It was started by a psychiatrist called Aaron Beck. And before that, there was similar therapies also, but he made it very popular. So actually, this is something not totally new. Even some Greek philosopher Epictetus said that people are not bothered by the problem, but the view they take of it. So that is the key thing. Suppose you have a problem, same problem, different people may see it differently. So the cognitive behavior therapy, actually what happens when we are emotional, we look in the same groove. So one of the technique we used is, okay, now you have a problem, you are thinking this is the problem, okay, for a minute you forget that is your problem. Your friend has come with this problem, how will you advise? You will find a solution because you are not emotionally totally involved. Now you detach and you look objectively and you find a solution. Cognitive behavior therapy helps people to think in a more practical or realistic manner. It doesn't make, there is nothing like positive thinking. I hate that word positive thinking. You can't think just positive knowing that it is not right. We have to develop realistic thinking and realistic solutions. not some positive thinking and you may feel temporarily happy, but again you are back to where you are. So any of you want to kind of improve your this thing, I request you to read about cognitive behavior therapy. It's very easy nowadays. The chart or the AI is giving you what is cognitive behavior therapy, and it will guide you. And it is very important that everyone develops that kind of approach where you are detached from our past thinking or our this thing. It's very helpful, cognitive behavior therapy, even for normal. There are a lot of people, actually I was surprised that a lot of the Swamijis are using the techniques. Lot of Swamijis, and they are using the technique, but they are not giving the power to you to think yourself. They are thinking, okay, you think like this, you do this. You give the power to the person, let him think on his own, let him find his own solution. So that is what cognitive behavior therapy tells you. So
just to add on to that, sir. So just to add on, like for instance, like what he said, it's not the situation that creates the problem many a times. It's my interpretation of the situation. Like I smile at someone, or somebody smiling at me, or I'm not smiling back. There's a way how I attach an interpretation to it. It's a simple situation. Like I smile, the other person doesn't smile back. I feel, oh, maybe he didn't see me smiling. Simple. Or maybe he has some, ego, that he doesn't want to smile at me, right? Or maybe it's like, oh, how dare he not smile back? That's a basic courtesy that this person should smile back. I can also think that what a cultureless idiot this person is. Or, I can go over from there. Or I can also think, oh, this person is not smiling me because I'm not good enough. Right? Maybe because I'm bad. Maybe because I'm fat. Maybe because I'm short. Maybe because I'm fair. Maybe because I'm from this family or this background or this particular work. It is not that person not smiling that creates this challenge or the thinking. It's the interpretation that I attach. So in cognitive behavior therapy or any form of interventions, we work with these forms of our thinking, what makes us think in this particular way, and how do we change or alter these paths, and not necessarily from a problem space. In solution focused therapy, that's a different direction of therapy. We're saying we don't need to get stuck to the problems only. We can always work on what do we do from now on, what is the direction forward. So these therapies work with progress and growth in your mindset. How do we grow from this space? Like how do I alter my thinking so that I can function more rationally, logically, and approach situations in a way that is much more understanding. Yeah.
Right, thank you. So we will now have a breakup for how many minutes, madam?
10 minutes? 15 minutes.
15 minutes for tea.
15 minutes break for tea, and then we'll get back.
And, okay. We should have taken a few questions, but we'll do next. Okay, sir. Yeah, going okay. I think so, fine. But now the illnesses are coming, so maybe schizophrenia.
We request all the participants to kindly gather into the hall and please take your seats. We'll be starting the session in another 2 minutes.
So we have this slide on stigma and mental illness. After that we will have questions, and then we go into specific disorders, like understanding about specific disorders. So what is this stigma? So stigma, anyone who wants to say about stigma? Volunteer. What is stigma? Okay. Stigma is the kind of the main reason for reluctance to seek treatment. Stigma. So the people, particularly in India, have a lot of stigma. It is there everywhere in the world about mental illnesses, but more so in India. So there are many reasons. One is lack of awareness of illnesses. Many people think that mental illness means either weakness of mind or it is due to family or something, so they blame the entire family, wo to pagal khandan hai, this kind of things. So people, and there are sayings like you have to look for seven generations to look into mental illness before marriages. So all these things put a very negative kind of thing. Of course, mental illnesses are difficult, but then this stigma makes it worse. So very often the families don't accept that one of the family members has illness. And there are also misconceptions about psychiatric treatment. They say that, okay, once you go to psychiatrist, they will put you on medication and the person will become a zombie or he becomes useless and he will become more worse. So that is the kind of thinking by most people. And then our people also believe a lot in this kind of magical and spiritual treatments. Of course, my friend Keshav has referred to all the spiritual treatments, which I don't share that much, but that is how people are, right? I can't ask my patient to read Mrityunjaya mantra if you comes with some cancer disease, right? Same thing, people go for alternative. Usual time taken, it will take 2-3 years before educated family comes to us with a diagnosis of schizophrenia. They take 2 to 3 years. They have gone to a number of temples and dargahs and they have spent some lakhs of rupees and then they come to us after all that, right? And things are changing mostly because now we see many patients refer to us. The son is or daughter is in America. They hear about the complaint here. They say, please go to psychiatrist, and they check the psychiatrist, take appointment, go and see the psychiatrist. This is a welcome change, and our people are slowly changing. So what should you do? Suppose you think that one of your relative or friend has got some problem which you think is something to do with mind, or so you are not sure whether it is a mental illness or not. So just I suggest you take a consultation with a psychiatrist. There are plenty now. Actually, the numbers have increased so much. Now you find a psychiatrist in every gully also. Even a place like Khammam has got some 10. One district headquarter has 10. When Dr. Keshav started in Karimnagar, he was the one psychiatrist. Now there are 20 psychiatrists. So that is how many psychiatrists are available. So please take a consultation. Sometimes the patients don't want to come because they lack insight. They say, I have no problem. You can go without patient also, what we call family consultation. You just go, tell all the symptoms. So what should we do the next? Then the psychiatrist will be able to advise. Because people waste a lot of time looking for some source, how to approach a psychiatrist. Some people approach us. I said, why you approach us? You just find a psychiatrist on the list and you can go. Any psychiatrist is competent. So you should go to the nearest psychiatrist if you suspect someone has a problem. Okay. Now we take questions about the session so far, and then we go on to individual disorders like schizophrenia, depression, which are straightforward topics. And these topics are general topics. You may have questions. Any questions about topics in them? Yes, sir.
Yeah, good morning to one and all. The information is very informative because this is for the first time we are coming across all such psychological aspects, and it really helps us a lot, I believe. In the whole of the discussion or in the whole of your talk, we have not come across about the mind and the subconscious mind and that kind of a thing. When the brain is what is working on, psychology is what is connected to these aspects also. So how they are connected and related to this psychology. I'm talking about the mind and the subconscious mind. Conscious mind and the subconscious mind, in other words.
See, this is a very, subconscious mind was made very popular by Sigmund Freud, right? So we can't really discuss at length, but I will tell you what happened with the Aaron Beck thing. So what Freud said is that all our behavior, see, we are always interested in knowing why people behave the way they are behaving. We want to understand the people's behavior. A lot of philosophers have done it, poets have done it. You can find a lot actually. They have a lot of wisdom, right? And then when the Freud said it is the unconscious mind which drives the person. There are unconscious motives. And anyone who presented in the therapy, he used to kind of ask them to lie down on the couch, and then he used to talk to them. Then he used to interpret their dreams to understand what is going on in their subconscious mind. And in 1960s, when this Aaron Beck, himself a psychoanalyst, he was talking to them, and what actually he found is that this person actually, it is not unconscious. So this person knows his problems. It's all because of thinking error, and he directly started talking to them about their issues, their problems, and how they interpret. So now over the period, now the Freudian thing has gone into very much underground, and there are still few practitioners who do it, and still few clients like it, but it is not as much like in like cognitive behavior therapy, which is a kind of manual based, a specific problem, specific way you address, and you have 10 to 12 sessions time frame. But whereas previous psychoanalytic therapy can go for lifetime also. So unfortunately, I am not the one who go for that kind of. So because I told you that I don't believe in anything which is not practical and which is not visible, right? So, but some people like it, unconscious mind and all that. But what is your take on that? You may be doing
same. So it's like I started my journey in psychology by believing in these concepts, and I was drawn to it by that, reading all the books and fancy self-help books where they talk about unconscious and there is some big mystery that I need to unveil. Like all that thing was there. But as we studied, what we realized is that it's a very abstract concept. Mind is a very abstract concept. It's not something that we can see or only what we can experience. Now, how do we experience it? In ways like my thoughts, my emotions, what am I feeling, what are my worries, what are my concerns, all these belief systems, and that's what it is. It's a combination of all that, and my memories and things about the past, what happened in the past. Now, some of them are accessible to us, some of them are not accessible. For example, I think about when I was in 8th grade, I fell down from the terrace and I broke my leg. I remember that event. I don't know what happened the day before. I don't remember what happened the day after. So I can say that that is in my unconscious, or I can also say that it's not readily available in my memory. The same way, I met 10 people in the break, and many of us exchanged the names to each other, but we don't remember everyone's name. Like in a function, we say hello, hi, and then we introduce each other. We may remember some name because we repeat. So that's the way our information is getting stored. So mind we talk about is a very abstract concept. Unconscious is what is not available to us in this moment. Now, some of those information can be made accessible by using some techniques like hypnosis. We might think deeply, or we sit and think about it long time, it might come up in our mind. Like when we write exam, we don't remember the answer, but once the exam is over, the answer comes to our mind. Something like that. So it is similar to that. So let's call it conscious. That is what is aware, what we know what's happening. Then there is something called non-conscious. That is not conscious. That's all. So it is very simple, like sir said, practical, straightforward, what we can deal with. Now some people, some professionals, they prefer to use unconscious as a way in which they can work with people, and it is, it's very effective for some people. Now they use that, but even there, the methodology that they use is, how do we work with the thought, how do we work with the memory, how do we work with the experience and emotions, that's it. So, it is abstract. We don't have a definite say that, oh, this is where the mind exists, or this, we don't know.
Thank you, Baijesh.
Good morning.
Yeah.
Just one small thing. Now,
sir,
okay. Good morning, sir.
So, for common people, how to develop concentration and memory, sir? This is a simple question, but it is useful to everyone.
Oh, okay.
Can I add one question to here?
Okay.
Good morning to doctors. Just one small thing. Gentlemen to the forum, I am thanking you. A is not a replacing psychologist. Good. Now on internet basis, so many questionnaires are AI interpretations are available to the public in per se, for their individual personality development. Okay, as per clinical or psychological treatments, how you are handling ethical values or family ethics in your process. Thank you.
I think we are going to have a talk on personality, so we can take that question later, right, sir? The personality thing, right?
We'll take the question answers last.
Yeah.
Because
Okay. Right.
We'll take it all together.
Okay. I think we could finish this and then we'll do it. Yeah. Okay. What was the question?
Memory and concentration.
Okay. So the memory and concentration, we can't really answer that question because it takes too long. So if the person is interested in some topic, then of course he will be able to concentrate, and memory also depends on individual capacity. And if the person has memory problem and concentration problem of recent onset, then he should think whether he has developed any depression or anything like that. So the thing is to consult someone to see whether there is a problem or it is. So it's very difficult to answer in a general way. Yeah.
Sir, you just mentioned that it is very difficult to say where the mind a bit on that, because there is also a confusion that the way people think is also dependent on the number of microbes and how they behave in our gut. Yeah. So can you just, because it's a bit confusing where the mind is.
So what I was, thank you for asking, what I was trying to say is that it's a process rather than one single entity. Like you can say it's a function of brain, like all your thinking processes and everything, combination of your thinking process, combination of your endocrine glands, all the hormones, what the function that they do. We can look at it as a process, as a function rather than a single entity like an organ, how we can pinpoint. That was my intention of saying it.
So basically brain is the thinking apparatus, no doubt about it, right? But it is influenced by various chemicals in the brain. For example, if you drink alcohol, suddenly you become very courageous, right? If you take some other drug, you become something else. So the brain is influenced by all these chemicals, even the gut, whatever. All these things influence the brain. But the brain is the key thing as far as.
So by controlling the chemical, you can control the brain.
The chemicals, yes, that is what the medication does. Some of the medications do exactly same.
Yeah, so there's just one more thing that I would like to add, and I had this conversation going on outside as well. The idea was that how is the brain different from the mind? And I think, and I have been facing the same question throughout because I'm also a psychologist. So think of brain as a hardware and the mind is a software. Right, so at the psychiatrists out here, the esteemed psychiatrists that we have here, they are the ones who are focusing on the brain, the structural part which is inside the skull. And the psychologists that we are here, we focus on the thoughts, not on the structural part, but on how the brain functions to produce the mind. And I think we had started with yoga. There is a very big field of philosophy that talks about Advait or Dvait. So is the mind different from the brain or are they the same? And frankly, are we different from mind or are we the same? So these are controversies that persist even now.
Thank you, madam. No one has asked any question about Atma. I am very happy about that. We'll go with the next.
Yeah, sure.
The time you complete, we can have a
Yeah.
Just realize Atma by the time you complete.
Because because psychology is a subject where everyone can have their own views. So it's unlike other medical subjects.
We will try to stick to what's scientifically available for us at this point in time.
Okay. So common mental disorders. So should we know about this? Because we included this because most of you are leaders, means either you run a company or factory or office and you deal with lot of people, and the knowledge of common mental disorders will help you to guide people under you, and it will also help you to kind of assess roughly. Suppose to knowing about personality disorders will also help you in your day-to-day management, right? So first we go to kind of schizophrenia. any schizophrenia means usually people come to my mind, split mind. Split mind, very dangerous people, that is how people see it. But schizophrenia is the most devastating and serious mental illness. A person, sometimes you see people on the street and they will be picking up food from dustbins and eating, their clothes are all, and if you go near them they smell like horrible. This person most likely to have schizophrenic illness. And then a person who is sitting in a kind of corporate office as a chairman or vice chairman can also be suffering from the same illness. So the word schizophrenia does not mean anything to me, because he can be someone who is functioning near normal with the suspicion that his junior is plotting against him with deep suspicion, and sometimes he may be hearing some voices, but he will be functioning quite normal. But then there is someone picking up from the food from the dustbin. So much extreme the diagnosis schizophrenia. There are usually about 1%, 0.5 to 1% population is affected by this severe illness. It's a very kind of, there is heavy hereditary loading. Suppose one parent has schizophrenia, there is a 10% chance that one of his children might develop this illness. If two parents have schizophrenia, the chances increase to 40 to 50%. If we have got what is called monozygotic twins, from the same kind of fertilized egg, two children come, they share the same genetic material. If one develops, the other one has 50% chance. So it's a very heavily genetically loaded illness. On CT scan, you don't find anything. You may find slight changes, but not specific changes. So the pathology is definitely there in the brain. There is a neurochemical abnormality. But how, there are mainly, to make it simple, there are two types of patients in schizophrenia. One is type 1, type 2. One in type 1, they have kind of positive symptoms. These positive symptom patients will experience some symptoms. They experience hallucinations. They hear voices without anybody there. So they will be sitting in a room alone and they hear as if somebody calling. And sometimes they constantly hear people commenting on them or asking them, suppose someone is cooking, she will hear the voice, put more salt, put this. So like that they have that kind of command hallucinations they will hear. And then some people will have delusions, false beliefs. False beliefs are false belief without any basis. So a person may be believing that his neighbor is plotting against him, or he is trying to take away his property, or somebody is trying to doing, particularly villages, somebody is doing chetabadi or black magic on him. There are many incidents where the family members have gone and attacked that person and killed. Actually this person was suffering from schizophrenia, but he influenced, because he otherwise looks normal, his family members believed him and attacked the other person. I will give you to one case example particularly. Typical case which we see nowadays is the child is in America, some 20-year-old. Unfortunately, it starts around 20 years of age. He is in America, he is in studying some MS or something, and then he stopped going to college, and then on inquiry he says, no, my roommates or my professor is trying to harm me, and I don't want to go. And then the family thinks that he is right because he is a white, he is probably racial, and they think they try to kind of soothe him on the phone. Sometimes they go there also, and then this person further, not necessary, but some of them may develop clear hallucinations, and some of them actually told that they have put chips in my brain and they are monitoring me. I am tracked throughout. The FBI is involved, all sorts of things. In spite of that, I have seen both parents, doctors, they have not brought the child to a psychiatrist. And that child, was brought back from USA, went on to take a serious overdose, nearly died. Then they came to me in Hyderabad because they don't want to go to psychiatrist in the town. So this is another thing. People used to travel to Bangalore before because they don't want to go to any local psychiatrist because of stigma. So this is a typical case where people have a similar thing. A husband may have suspicion that his wife is having affair, or a wife may have a suspicion that my husband may have affair without any basis. So this is a common type A presentation, one type of positive symptom presentation. Then we have another group of schizophrenia patients who have a negative presentation. They don't have any symptoms like hearing voices or outward. These positive symptoms, because of their delusions, they have aggressive behaviors. Sometimes they attack the other person. When they think that the person is doing harm, they attack the person. There are many incidents where they have killed the person also. So a lot of things have happened. So, but this negative person, he doesn't do anything. He will sit at home, stops going to college, days together he does nothing, he eats his food little bit, goes into his room, doesn't interact with family members. Family thinks that he has got some depression, and it goes on. Usually depression is 6 months maximum, but this goes on for years, and his self-care is also there. He is not taking bath, he is not exercising. Still they don't bother, but this is another type of presentation. When things go like this for long, then they develop speech abnormalities. Their speech becomes fragmented, unconnected. You ask one question, the answers they start and they go into some other topic. So like that, so that flight speech disorder will be also there. I was just smiling because some of our speakers also drift from their original topic, right? So you have to be careful about whom you invite, right? So this is this negative schizophrenia actually has a worse prognosis. Treatment is usually medication, and the negative one doesn't respond, but the positive ones can make very good progress. I don't say they become 100% normal, but they become 80% normal, will be able to hold their job. 60% of them will be able to do very well. But the only thing is they have to come to treatment as early as possible. And the treatment is not expensive. Hardly it costs anything, 200-300 rupees per month. And we have so many patients. Some of them, they come once in 2-3 years because in India you don't need prescription to buy your next prescription. So they keep on buying, and it's okay, fine, as long as they are doing well. So this is about schizophrenia. And so usually an acute treatment, when they are very unwell, we may have to admit them for 2-3 weeks. Once they are stable, we discharge them. The main problem with these patients is that they don't take their medication. And they get well, go home, they think that we are fine, we stop medication. Family also immediately agrees. They don't discuss with the doctor, no, he is doing fine, why we should take medication. Then again he goes back into the same, after a few months again he will come back for another admission, what we call revolving door approach. So the key thing for the family member is to take medication. If you don't like your doctor, go to another doctor, but take the advice of a psychiatrist. That's very important in this condition. Next condition we talk about is depression. Depression is a very common condition. Recently I have read that at any given time 16% of Americans are on antidepressant medication. 16% on, how many of you are on this medication? I don't think anyone is taking antidepressant medication. Maybe in India it may be 1%, 2%, I don't know. So the lifetime prevalence, 30% people in their lifetime, they have depression at one point. 30% of people experience depression at one point, and it is very easy to diagnose and treat, but unfortunately our awareness is so low that very few people come for treatment. Recently few incidents have happened. One incident is where a 40-year-old lady with her 2 children, intermediate grown-up children, she walked in front of the train and she was knocked down. You all hear that case? You all read that? Yes. Very tragic. That woman has no problems whatever, and all this media was focusing on whether husband is having an affair, whether they were not saying, but indirectly they were saying whether this woman has something to hide. All this was talking, and lot of posts, everybody posts. In India, posts is your freedom, no? So you post. But no one is talking about possible depression. Even after the concluded the diagnosis depression, still the media was going around finding out what caused depression. What they don't understand is depression need not have any cause. Depression is again a neurochemical imbalance. It can have a heavy hereditary, and it can also have outside factors also. But outside factors need not be present when this loading is very high. So probably she had that kind of loading. Because so many people have problems like husband staying away, something. They won't commit suicide. There will be so many suicides if that is the reason, as our media is speculating. So it's very important to understand about this key condition. So what are the symptoms? I will take this in bit detail because it is important, right? There are three main symptoms for depression. Two of them have to be present. One is that low mood, not just low mood for short time, low mood most of the time, on most days, over a period of 2 weeks it has to be present, low mood. That means the person feels low. Normally we feel average, some days we may feel bit happy, some days we feel bit low, but this low has to be over 2 weeks. And then there is a tiredness. The person gets tired very easily. Previously he used to do a lot of work, but now half the work or 40% of the work he gets tired and it doesn't like to go further. And the other main important is lack of enjoyment, loss of interest. So they lose interest in doing things. There is a marriage invitation, usually they don't miss, but this person, oh, who bothers? Some visitor is coming, they don't bother to meet them. So they lose this interest in life and activities. Even if they go for activities, they don't enjoy. They don't feel that enjoyment. So these are the three main features of which two have to be present. And then there are other features like lack of concentration, memory problems, or sleep, difficulty in falling asleep or waking up early, particularly waking up early and then not able to go back to sleep. Appetite can also be reduced, there can be weight loss in severe ones. And then there is, the other thing is about the thoughts. The person's thinking changes completely. He thinks that he is useless, he has failed, he has not achieved. He might be successful also, but he may think I should have done much better. I have failed, I am a failure. And then he thinks that nobody is going to help them. The future is bleak. Then comes the thoughts of, okay, I wish that I sleep tonight and don't get up, that would be better rather than carrying on with this life. Then they go to think that, okay, what suicidal ideas, thoughts and plans, and actually they may commit actual suicide also in very severe forms of depression. So this is about depression. And there is a questionnaire called PHQ-9, which I think we should be able to circulate by afternoon. That questionnaire, actually there are 9 questions and it is available free on internet, and you can tick the questions and then you know the score, whether you are mildly depressed, moderately depressed or severely depressed. It may not be 100% correct, but if someone is severely depressed, it will show at least moderate. So it is definitely helpful. Before, if you have any doubt, you can do the PHQ-9 scale, and the questionnaire given by GHQ-12 also looks for depression, but this PHQ-9 is more specific for depression scale.
It's only a screening tool. It's not a diagnosis tool.
Yeah.
Okay. It only tells you that, oh, maybe there's a possibility that you need to probably talk to someone.
Yeah, you need to, if it is, if you are scoring moderate, then you should see a psychiatrist or psychologist, clinical psychologist for help. If it is low one, it's okay. You can ignore or you can still seek help. It's up to you. So then we have another kind of illness called bipolar illness. So we learned that in depression, the person feels low, but in bipolar, the person feels low for some time and then he feels average, and then suddenly he feels very overactive, energetic, happy. That is called mania. So he has got some depressive episodes, some normal periods and some manic episodes. In that manic episode, the person he keeps getting a lot of racing of thoughts, very positive. The world looks wonderful for him. He feels very happy inside. The problem is a lot of people take decisions which involve like starting new factory or expanding their business, And I have come across people who have lost crores of rupees. One person actually, his friend was losing business. He said he will take it up and he will change it. And that person said, no, it cannot be done, it is all gone. He did not listen. And he said, no, he invested his money and he lost his money. So this is how a manic person can behave. Sometimes the mania is not very visible. If it's very severe mania, he will be singing, dancing. He is obviously, people say something wrong and they will take to psychiatric hospital. But in hypomania, milder form of mania is very difficult to find out. So if somebody is, you think that it is going bit different, is taking too risky and his thinking is, then you should really think about possibly he has got hypomania and his thinking is influenced by, again, chemicals in the brain, not his original thinking. So that's again, the treatment is usually, we use the same medication as used in schizophrenia, like antipsychotics, and then we usually, the treatment is for kind of, they are quite, we take all the questions at one time. The antipsychotics, usually both in schizophrenia and bipolar, the medication continues for life. Sorry to say that is how it is. But for depression, usually the treatment is few months of medical treatment, but more important, there is cognitive behavior therapy for relapse prevention, so that he won't get future attacks. So that helps it very much. So for depression, you use both medication as well as cognitive behavior therapy. If it is mild, we use only therapy. If it is moderate, you can use both at his choice or a combination of both. If it is severe, medication first followed by therapy later. So this is for the treating psychiatrist and your psychologist to decide. They discuss together also, right? And you want to add anything on the depression or anything?
No, so it's what you said, sir. This is one which we see common among youngsters and old people also. Now sometimes, there is a person who was functioning pretty okay, and suddenly there's a retirement and there's nothing else to do, and then there is an emptiness. Now there may be a low feeling and they usually cope, but some people that kind of prolongs and you see similar symptoms like depression coming up, which as said, the symptoms like low mood, the tiredness or fatigue, and then you will always notice that changes in the sleep patterns, the appetite and all those things. Manic symptoms are easy to notice compared to the depressive features, that the person will become very talkative, highly energetic, doing things that's like completely out of the bound. Like the last week, one of my friend's daughter, she is around 29 years. She bought books for 2 lakhs rupees from Crossword. And this person got really panic and he called me, Baijesh, what's happening? I said, yeah, take her to the hospital right away, don't wait, and then we'll sort out everything else later. Because she has been not sleeping for last 2 nights, highly energetic, and she was almost about to buy the cryptocurrencies Sola or something for almost 12 lakhs rupees. Just before he caught, that the message that she spent this much amount on the books and the books got delivered to home from Crossword. Now this is an episode which was sudden. Within 3 days we were able to recognize and get the treatment. So things like that. We don't know how it is coming, to whom it is coming, and sometimes that's the way some people invest in new projects. Identifying that they feel that they can turn things around, and then suddenly they have ideas which may be not even realistic. Yeah.
So one famous example, this bipolar, is Winston Churchill. So he is the World War II, he led England to victory. He suffered from bipolar disorder. So illnesses doesn't spare anyone, right? So
and for depression, we have a very popular celebrity who has been quite vocal about it, Deepika Padukone. Yeah. She's been quite vocal about how depression has been a challenging phase in her life.
Yeah, she is now a kind of ambassador for depression campaign. And the thing is, there is actually one person few years ago committed suicide in Hyderabad. She said, it is not my mind, it is my brain which is a problem. She tried, but she couldn't help herself, and because they have that kind of feeling which is indescribable to other people. You think, why she got everything, why she killed herself, stupid. But the feeling, the suffering, that experience, they only can tell. They find no joy. The life is a continuous, every day is like a punishment for them, and they have gone through repeated episodes of treatment, success, again go back to that, and at one time they give up. We unfortunately, we do lose patience, and we have to accept that we couldn't help some people. That's the reality. So, for depression, for mild depression, I would, cognitive behavior therapy, I want to talk few words about behavioral activation. What happens when a person is depressed, he withdraws from his activities. He slows down, and that he doesn't seek pleasurable activities. That makes a negative vicious cycle. He goes further into low activity, further no enjoyment, further low mood. To break this, cognitive behavior therapy wants them to do activities gradually in a regular manner. Don't stop your activities. Do at least some walking, meeting people, talking to people, thinking positive. So, thinking positive, you have to see a therapist, and they will have 8 to 12 sessions. But behavioral activation you can do. Suppose mild, you can start exercise itself. They have found it to be as good as therapy. So, if you are depressed, get into activities. Don't withdraw. That is the key thing. For mild, that is enough actually. Okay. Next, we go into anxiety disorders, right? So, anxiety disorders, usually the symptoms are the person has got some worry, fear in the mind, something wrong is going to happen. It's very common, actually, again, it's more common than depression. And then the symptoms have both at the mind level and at the physical level. At the physical level, the person may have palpitations like heartbeats, and then they may feel sweatings, they may have butterflies in the stomach and dryness of mouth. So, various symptoms. Usually the person experiences that he is feeling what is dhadkan or whatever. What is anxiety? Hindi word, sir? Andolna. In Hindi. Bechan. So, person feels bechan. Yeah, ghabrahat. So, usually the person identifies that the problem, and there are 4 types of these anxieties are there. The anxiety, in all of them, the anxiety is the main symptom. One we call as generalized anxiety disorder. The person feels anxious, but there is no good reason. He is always on the edge. For small things, he thinks too much, and he gets worried. So, it can be some people by temperament, some people are more anxious, some people are less anxious. If you watch the kind of National Geographic or Animal Planet, even in the animals you can see, some animals they keep on grazing, but there will be some which are always constantly looking up. So, this is a temperament. Some are more anxious, some are less anxious. So, the nature has intended it because someone has to do the guarding job. So, the anxiety person is like a watchman, like arey kuch gadbad ho ja raha, tu you have to be careful. You have to be careful about. But there is another person who is, oh, nothing will happen, we go ahead with the business. That is also wrong. You need anxious people also. But if the anxiety becomes too much, then he cannot function. Up to a level it is okay, but after that the person suffers, and the functioning also suffers because he cannot take any decision. So, that is a generalized anxiety disorder. When sometimes people have panic attacks. So, panic attacks are intense anxiety attacks lasting for only 1 or 2 minutes, where the person feels breathless, he is going to feel that he is going to die or pass out. Most of the time they end up in one of the corporate hospitals. After spending all their money, they come to us with no money because all the investigations are done, and we have to give them relaxation methods or whatever. So, that is panic disorder. And we have other conditions like post-traumatic stress disorder, which is usually after exposing to a very severe life-threatening trauma, the person will experience recurrent images of that thought. He will have that, even suddenly he will startle, and suddenly he will have that thought. In the night they may have nightmares, and they will also avoid going to that place or talking about the event, about connected anything to that. So, because it is so much very traumatic and deeply embedded in their brain. So, that is another condition, post-traumatic stress disorder. And we have, I thought mine, okay. Mine only, sir. Okay. No. Sorry, I think I have put it down. The another one is social anxiety disorder. This is very common, again important for you. Social anxiety disorder usually begins around 12, 13 years, that is adolescents. And the problem is they suddenly feel anxious to talk to new people. Usually they are comfortable with people known to them, small groups, but when it comes to talking to new people or a big group of people, they become very anxious. Some of the children even avoid going to school also. So usually these people also have kind of low self-esteem. They don't feel good about themselves. They go together. Sometimes they also have a bit of depression also, because they have low self-esteem, social anxiety, they can't socialize, they develop some symptoms of depression also. Social anxiety is very common probably in your office, in your workplace. If someone is avoiding going to new people, suppose your staff also, some people are very good and go and do the work outside, they are very happy. They go around very happily, talk to, introduce themselves, talk and come back. There are some people who are not at all good, they avoid. So actually your job as a business head is to find out what is good for him. So what jobs he is good at. Suppose if someone is good at going out and doing things and you ask him to sit in the office and work, he won't do proper job. But there are some people who want to sit and do the job, but they don't want to go out and meet people. So social anxiety people, it definitely affects the people, and cognitive behavior therapy really works for them to improve their self-esteem and also the social anxiety. They have to gradually expose to smaller groups, then bigger groups. Lot of teachers, if you see, or politicians, when they first come, they don't speak properly. But after 1 or 2 years, they become very good speakers. They are very comfortable. They don't bother about how people are looking at them, or usually the low self-esteem people, they think that other people are interpreting them in a negative way. So a lot of this cognitive behavior therapy helps such people. And then we have specific phobias are again anxiety. They will have fear of one particular thing. They are okay with most things, particular thing. Somebody may be perfectly courageous person, but he cannot get into a flight phobia, as you can simply call it. And some people are afraid of heights. They can't get into lifts, closed places. And some are afraid of animals like dog or even lizards. So a lot of specific phobias, and all these are respond very well to psychological treatment as first choice. So anxiety disorders, first choice is psychological treatments. Then we have a condition called obsessive compulsive disorder. Obsessive compulsive disorder is where the person has a recurrent thought or image that you have to, he doesn't want the thought to come, but the thought keeps coming into his head. Suppose if he has closed the door, he knows he has, but then if the thought keeps coming into the, you have not closed the door properly. He checks, but again the thought comes, he knows, but the thoughts keeps coming. To neutralize it, to reduce that, he will go and check again and again. So it is, most of it comes in around teenagers and again in older people also. The person suffers intensely, but because of fear that he is going crazy, he won't tell anyone. But this condition is very treatable by both medication and psychological treatments. OCD is a very common condition. About 2 to 3% people are affected. Particularly they do repeated checkings also. Repeated checkings, repeated washings. Repeated washings they do. And sometimes they have blasphemous thoughts. They get a thought, some looking at goddess, they get some dirty thought. They feel very bad. Or looking at some person, they get dirty thought and they feel very bad. And they suffer quite a lot. So this is a condition which one should be aware of. Right. Please add.
Just to add, yeah. So these anxiety conditions have one thing in common, that is like there is a pattern of avoidance that you can see in them. You know, you are fearful about something, what do? You would avoid. You are scared about something, that situation you try your best to avoid. There is a situation which reminds you of something bad happened in the past, a trauma, you would avoid. There is a thing which probably has it might be having germs, so I might not touch, I avoid. So there is a pattern of avoidance that we see that generally in individuals having anxiety issues, and all these has, like for instance, I'll tell you an example of a client that I had. So this person was a lieutenant colonel in Navy, and he got a promotion. And then there's a break, and he came home, and his sister brought him to me. Now, he came and told me that, Baijesh, I'm a Taekwondo double black belt. I also know a little bit of Kung Fu. He looks, like Hrithik Roshan, for example, very tall, really well built, and, looks like a proper built up gentleman. He says, I'm quite courageous. If there is a tiger comes to me, I might even give it a chance to fight it, but I cannot stand a cockroach. Yeah. So usually they have to address the team of, people in the ship, and he would usually go there, but this time now he has to lead the addressing part, and in the pantry, whenever this is happening, or in the dining hall, there are cockroaches. He gets scared. So every time he used to say that, oh, my health is not good, or my BP is low, my sugar is low, and he would escape whenever he gets this extreme anxious things. But now he cannot, because he has to lead the meetings. And as I inquired, his mother has it, his sister has it. Not that it is a genetic condition, but probably it could be a learned condition. Because they were scared, he also watched them getting scared, I am also scared now. Right? So the 42 years of his life, he suffered with this fear. And within 3 weeks, we had to do something, and the only thing we could do was to expose him to these cockroaches. And in 3 weeks, because we met every, once in 3 days, in that rigorous, process of exposure therapy, he overcame the fear to a great extent that he could hold this dead cockroach in his hand. We make him do that, even though it feels very eeks for him, but he was confident. Otherwise, if at the sight of a cockroach, he shuts down. The entire system shuts down. Like, this is the extent to which a phobia, a person who is very rational, very brilliant, very intelligent, they freeze the moment the anxiety attacks. They are not able to think. The panic attacks are like that. So there's this office space where I went for a talk, a corporate office here, and in between a person started breathing. This is the way they come. And then they kind of fall and they shrink, they sit like this, and they feel that it's as if there's a cardiac arrest coming, or there is something going to happen and I'm going to die, I'm going to choke and die. That's the kind of feeling. They feel something like a death nearby. And that point in time, people around doesn't know what it is. They also panic. Call ambulance, call this. So we do not know. That's just a panic attack sometimes. Panic attack can be sudden. There is no reason. It is abrupt. Completely, totally random. And what happens as a result is that the person suffers quite a lot, and he doesn't know when it's going to come, so he would avoid situations where he would go. OCD is very common. The other day, this client, she was brought to me not because she has a mental illness, but because the water tank is getting emptied twice a day. The reason is that we need to fix this because she's using a lot of water and we have to pay for the water. Now, it is not her mental health condition that was, that became a challenge, and others recognized that and they wanted to support. No, they wanted this problem to be fixed. How do we stop her from using a lot of water? She cleans the house 3 times a day, pouring water. And she uses a lot of detergent and hand wash soaps. Her hand is bleeding. I can see the skin peeling off. And everything sanitizer and this and that. So we do not know how people are having these symptoms. It could be different ways, one condition, but various symptoms. Symptoms varies from person to person. There's a client who was working in an office at a VP position. He mandates every printouts that is taken, they should be taken in a blue color paper, not white anymore. Or things like that. It should be arranged or organized in this particular way. And every time he walks, he touches anything wood 3 times and then only walk. And if he walks past something wood and he doesn't touch, he'll come back and touch it 3 times. Now this person is a very well accomplished, very senior manager position person, developed the symptoms in the last 6 months. So far everything was good. And it didn't affect compromise his ability to think or function or anything, but this is disrupting his function. And he knows that he doesn't need to do that. That's the worst part for him. Like, I know I don't need to do that, this is not required, but I still cannot stop from doing that. So things like that.
Yes, thank you. All questions at one time, sir. That's what, yeah. Then we have a disorder called psychosomatic disorders. So basically, psychosomatic disorder, they have physical symptoms. Complaints are physical, either body pains or some weakness of the arm, paralysis, or sometimes loose motions, irritable bowel kind of symptoms. In children, before they want to avoid school, they develop kind of abdominal pain kind of symptoms. These are some psychological conflict is producing physical symptoms. On investigation, extensive investigation, medical, they don't find anything. Sometimes in the cardiologist also they don't find anything, but the person complains of some pain or this thing. So usually what happens, what I give an example of psychological conflict. How suppose a woman is there and her husband is a very successful businessman and he is busy all the time, and she doesn't find any time to spend with her, right? And without this development of symptoms are not deliberately produced. They are subconsciously or psychologically produced. So she develops some kind of physical symptoms, and immediately the husband responds, takes her to doctor, spends time. Every day he inquires about the medication, he spends some time. So she is gaining some attention. That's what we call as a secondary gain. So this is how this attention will maintain the symptoms, because as long as she gets the attention, she will continue to have the symptoms because it is serving a purpose. So it is very difficult for a psychiatrist or psychologist to treat, because we can't tell the husband that, okay, this is how it. So we have to very nicely tell them how to reduce the visits to doctors or giving too much of attention to her, and how to go with her. But it is usually the problem lies somewhere else, somewhere in the interpersonal domain or somewhere. So that is how psychological conflict, an example, can produce a physical symptom. So there need not be a medical cause always for physical symptoms. That is the importance of this condition. It's quite common condition. And then we have alcohol and substance abuse disorders. The alcohol and substance abuse disorders, we can't go into detail into each one, but when will you call someone has got a problem? So what we in the medical we say is alcohol or this dependence. So when is someone is dependent on a drug, when is it's a real problem? So usually for that again we have certain guidelines. One is that there is a physical symptoms of dependence, the physically. So what happens when the person is taking alcohol, and if he is taking regularly heavy quantities, when he stops the medication, he will develop withdrawal symptoms. So usually after 12 hours he will develop tremors, and usually they drink in the morning. So if somebody is drinking in the morning, is 100% nearly sure that he has got a severe problem, because to reduce the tremors, he will morning, the moment that wine shop is open, they are standing there. They are the first buyers, and they drink, and then they become steady. And then there is other thing is, if they don't drink for 48 hours also, they can develop seizures, and they can develop delirium tremens, which is a very serious condition where they kind of not in a proper sensorium, they get disoriented, they will be running around. Probably in Nizamabad you have seen that people have, one person has ran over the roof when they were adulterated with benzodiazepines drugs, and that was stopped. They became like that. So what happens is, when somebody wants to stop actually severely drinking, we have to admit them for a week, and we have to do the detox, and then we further take them for counseling or medication. So the main criteria, one is physical, and there are other psychological criteria also there. That there is a significant impairment in his work, that he is not going to his work, he is spending all his time procuring drink alcohol, he is preoccupied all the time, his focus is about alcohol only. Then he also developed health problems. In spite of developing health problems, he is drinking, and then he used to drink some 3 pegs a day he moves to 4, he moves to 5, 6. Like that, when people are drinking or taking drugs over a period, the quantity has to increase to get the same effect. That is called tolerance. So tolerance is a very important thing. That is, the body does it. So the people have to take more and more to get the same effect. So for all the drugs, this tolerance, withdrawal, this kind of occupational impairments, social difficulties with the family, there will be a lot of problems. All these things are common. So when you have this, that means they need a definite medical attention and they need to be taken up seriously. The role of family is very important in bringing the person for treatment, because that person usually doesn't accept that he has a problem. The main problem in treating any of these problems is they don't accept that they have a problem and there is a need to change. They say, I can stop anytime I want. If I want, I can stop, sir, no problem. I don't need any treatment. That is how they respond. So this is briefly about alcohol and other drugs.
I would like to add on to this. First, I would say that any form of drug at that level, any substance that would alter your thinking, your ability, your emotions, anything is bad, even if it is in a small amount or small quantity. And I'm seeing children as young as 8-9 years using substances these days. That's the extent to which it is rampant in the society. In the schools, I see 11th grade, 10th grade students peddling drugs to others. So that's the instance which we are leading, and we cannot put a blind either. There are people who would say that marijuana is not really that bad. Having a smoke might elevate my thoughts and stuff. It is the moment it goes beyond that, like how Sir said, to reach to a dependence. We have seen extremes where it's very difficult to bring them back to their normal functioning. It affects their ability to function independently. So any drug that would alter your ability to function is bad, and I think we need to be really watchful. If you have young children at home, we need to sensitize, we need to educate them how it is not appropriate, and most importantly, accessibility is the major issue here. You have alcohol at home and you trust your kids. I'm glad you trust your kids, but if they watch you having it, you're a model to them, and you tell them that until 18 years you cannot, but we do not know whether it's the quantity is getting reduced from that. Most of these people who started smoking, they smoked the little bit remaining part of the cigarette that is left by the father or grandfather or the uncle. That's where they start. They start the alcohol from home. They start marijuana from home these days. I see, people who are using that thing, the children seeing that and noticing, what is this? And I ask most of these children, because I'm a consultant to different international schools here, and I interact with the children and I ask, where did you find this? They are using LSD like stamps, the chemical substances. Where are they finding it? First time I used without knowing from my home, or then other friends are introducing, and there is a network they are trying to tap. Now it's not just to the children, even for older people, adults, it is a challenge that we need to be really watchful. Substances are really bad. Any substance is bad. Sorry.
Yeah, thank you. And we also have a number of other addictions, like internet addiction now, gambling, pathological gambling, and this gaming addiction. So there are newer forms of addiction. They all come under the addiction disorders only. Basically the problem is these people have kind of personality to develop these problems. Again, a lot of genetic loading will be there, and treatment is mostly psychological treatments.
So we had a patient who played Dream 11 and lost 60 lakhs. Only on betting on cricket, I'm not talking about poker and rummy. It's Dream 11 app which is promoting and is, rampant here. They lost 60 lakhs, that's a young fellow. And he used father's account. So, this is the extent to which it is happening. And the internet one, the screen, that's a very, that's addictive. Increasing quite, I think even across not just children, even older people, because they watch a lot of TV and, now this is phone and YouTube shorts, reels in Instagram, and you keep watching, and every content is 10 seconds, 20 seconds and made like that, and you don't even know how much time you're watching.
And it affects your sleep, it disrupts your sleep because you keep watching even in the night. And then you complain that, oh, I feel tired. Many times people come up with such complaints that they are feeling tired when they wake up in the morning because they fall asleep much late. Because the screen, the blue light, keeps you awake. Yeah, things like that. It leads to an addiction because you cannot function without that. Like you have, you are there without phone for 10, 15 minutes. You feel like, just like that checking. There's no call, there's no message. You just take, is there anything? No. Just frequently checking, things like that. We'll see that.
Okay, next we go to old age problem. One common problem is dementia. So dementia means basically irreversible loss of mental functions which you have previously learned. So like mental functions like memory, doing things like that. So usually it is essentially a disease of old age. So the most common dementia is Alzheimer's dementia. So people above the age of 65, if you look at them, about 5% of them will have dementia, but Alzheimer's dementia. But if you go 80 plus, 20% people will have, 1 in 5. So it is essentially a degenerative disease of the brain linked to old age. Some people are lucky they don't develop, instead of living up to 100, but quite a good, 1 in 5 will develop this kind of problem. So in dementia, initially they lose kind of memory impairments, and over a period of time they even forget family members' names also. They will not be able to do functions which they were used to do, like able to brush and all that. They can't take care of themselves, cannot wear clothes because they cannot do so many functions. So big personalities like even Baijesh ji had this problem, and we know Ronald Reagan had this problem. So unfortunately the treatments are there, but they help only in the early stages because there is a acetylcholine, brain chemical is less. Just like insulin is less, you give some medication to work it longer. So these medications work in the initial stages, but once the dementia progresses, it doesn't help. And prevention, people talk about Sudoku and all that, but there is no evidence for anything. But if you are intelligent, you have a cognitive reserve that will help you to function better for longer time. But then there is another thing called vascular dementia, which is next common to Alzheimer's. The vascular dementia is usually due to hypertension and diabetes. So that can be helped by taking proper care of diabetes and hypertension. And severely there is an alcohol induced dementia is there. Heavy drinking of alcohol can also cause dementia, memory impairment and dementia. So there are other treatable causes of dementia, but Alzheimer's is the most common. One particular dementia which only affects the frontal lobe, their memory can be there, everything will be, they will be able to function, but they will have degeneration of the frontal lobe and they have a lot of disinhibited behaviors. They will be behaving improperly with some maids or sometimes with your own daughter-in-laws, and this will be very uncharacteristic and people don't understand. They think that this old fellow has become an evil person, which is not. So basically they have to think if any person is behaving different from what they are before, you have to think that some pathology is there. Don't think that he is doing it deliberately or for some reason. Even if he is previously like that, if his behavior is exaggerated, it is always better to seek a medical opinion, because this is something which is commonly missed in our population that we have seen. Okay. And then so the management usually will be to make their life comfortable. These dementias are terminal. Usually they live 5 to 10 years. Gradually they decline. There's nothing much we can do except supporting them, right? You make their life comfortable, keep room. They can't go to new places. That will be more confusing. Keep them some aids like bathroom. You put a poster so that they know that this is bathroom. Day calendar you put so that they will know today's day. Some orientation about things. People come and ask, this fellow should go and introduce, I am so and so. Then that, these people are also very clever. How are you doing? Fine. Beta kaise hai? Mere ko pehchana. So that's not that. So people have to go introduce themselves and tell, then brain keeps active. The memory becomes a little bit active. So that's how about dementia briefly. And then we have conditions in children. I have taken up this ADHD because I am a child psychiatrist, deal with a lot of ADHD myself when I go to UK. So ADHD is kind of seen from the age of 6 onwards, usually we keep diagnosed. It is attention deficit hyperactive disorder. The word itself is self-explaining. So there is an attention deficit and there is hyperactivity. The child is hyperactive, right? From morning when they get up till the sleep, they are fully active. Parents wonder where this fellow has got this much of energy, and because they cannot manage him, because he has so much of energy. And when he goes to school, he cannot sit quiet in the classroom. He disturbs the child next to him, and he cannot also focus. Any activity, homework is very difficult. After 10 minutes, he will get up and he will run. Again, the mother has to forcibly bring him. He will sit for 10 minutes and again run away. So like that, ADHD children have a lot of problems. One is that their education falls behind. Second is they are prone to accident because they are also impulsive. When they are on the road, they suddenly run without looking for the traffic. So they are prone to accidents. When they become teenagers, they are risk taking. They take to smoking, alcohol, all these things are drugs. They are more prone to take these things and become dependent. Many of the actually adult alcoholic or drug users, when they are surveyed, as much as 30 to 40% have found to be ADHD. So it is very commonly associated with high risk behaviors. So people are now more aware, particularly when they become adult. Some 60% will continue to have some problem, and they have problem with concentration at workplace. They don't finish the work, they wait till the last minute, and they continue to, they postpone till the last minute their work. And in the meeting, group meeting, they think about something else. They cannot focus. If you are talking to them, they cannot listen completely. They listen halfway and already they made up their mind. So they have some impairments. There is a questionnaire called ASRS. ASRS is a questionnaire which is freely available, and they can, we have put up that, no? ASRS questionnaire, did we? Yeah, it is in the folder. No. ASRS questionnaire, adult self-screening questionnaire, and if someone gets positive, they should see a psychiatrist. And adult ADHD, now more and more people are coming to us now. And another conditions in children, probably most people have repeatedly heard about, is autism. Autism and intellectual disability, they are kind of related conditions. Intellectual disability, previously we used to call mental retardation. The child's intelligence level is lower compared to other children, normal. So they are on the lower side. So if it is mild, they will have problems with schooling, but if it is severe, they may not be able to talk also. They may not be able to perform little things. So depending on that severe intellectual disability, there can be very profound, they can't do anything, their parents have to feed, everything they have to do. So that intellectual disability is what is called previously mental retardation. The brain development is not proper. And autism, there is no problem with intelligence by definition, but many autism children can have intellectual disability, IQ problems also. But autism, the problem is the child is not social. That when they talk to other children or play with other children, they don't see the other side. They are only one-sided, and they will have some kind of regular routines, keep doing the same thing. So it is a slightly different condition. We are seeing more of this also now, probably because of both the conditions are more common now because of late childbearing. So childbearing used to be some 20 to 26 years before women used to bear children. But now we have parents having children at the age of 30 plus, 35. So that is definitely creating problem. And I think at some point the government has to tell people to have children at young age. Instead of, the government has to give a health advice, because we are seeing so much of problem now. So they have to go for, no, you people may not agree, but I advocate early marriages. I know some communities in India also do it, and I think a good advice. What actually I saw in UK is they marry early, have children early. After that, the woman kicks off that fellow if she doesn't like him, and she will find another partner after some time. But they will have marriage early and children early. And I really see this biological function, sexual function is a biological function, and why they should wait till 30, 32 years. And we are having a lot of psychosexual functions also, problems also because of that. We have a lot of problems with erectile dysfunction kind of problems, performance, that also we are seeing more. So early marriage, I think people may not like it, may not agree it, but I recommend, my personal recommendation, and early children also. Okay. Then we have specific learning difficulties. So some children intelligence may be normal, all subjects they are fine, but the child may have problem with reading. They will get B, D, confusion, so they have problem with reading, or they may have problem with only writing. He may be very good at something, but may have a problem with calculation. So the one general advice is, parents think that any child can be molded into anything. That is a general advice. Lot of motivational speakers also tell that anyone can be made anything. Even sports also, anybody cannot become any player. Suppose if you have a football player, probably his coordination of leg muscles, his brain-leg connection may be very different from someone who is a tennis player. People have their natural kind of the brain connections, so that we have to respect, and we have to expose child to everything and see in which, because the child, whatever the child excels, the child likes it more and does it more. If something is not coming naturally to the child won't take up unless we force them to take up. So as parent, I think we should expose them to more. Some parents say, oh, my child has to become music, some singer, music something. And I know my wife used to take him to a music teacher. I told, apna khandan mein kisi ko nahi hai, where will he become this thing? And he used to sing, and the teacher used to say, he has got very good voice. I used to tell, he will tell that because he needs to do his tuition. Na? So this fellow has absolutely no interest. He used to run away. Ultimately, he learned nothing. So we can't force our interests onto our children. We have to expose them, study them, and give them what they are excelling. A lot of people have engineering, forcibly they have put, the fellow have dropped out. We see so many children, they have dropped out and went on to do something else. So this is a general advice about Baijesh.
No general advice in this space, but I just wanted to take a moment also, because we are approaching the time, is that stress is a factor that we generally talked about. Stress is bad, we need to minimize and everything. I was thinking that, stress is a factor that is inevitable. All of us are stressed about some or the other thing. So if I tell you my advice is that don't get stressed, it's like I'm telling you not to think about your father's name. Like that name comes to your mind. Don't think about who's India's Prime Minister. It just comes to your mind. So I say don't get stressed. It doesn't work. That's the way it works. Because when am I?
What time we have to close?
So when was I most stressed in my life? Was one of my happiest days. That's when I got married. I was most stressed on the day that I got married. Right? I was stressed like, how will I manage the situation? Whether the food will be sufficient, people will be managed or not, this or that. People get promotion, they get stressed. You go to a tour with family, you are stressed. So stress is not always bad. There is good stress also. That means you can prepare well, you can in advance, this is like good part of the stress. It helps you. The stress becomes bad when it takes over that you become dysfunctional. You start becoming extremely agitated and sad and not able to manage. Your resources are not sufficient and a lot of negative thoughts come to your mind. That's when we see, oh, the stress has a bad effect on you. Stress in itself not necessarily is bad, because it's not inevitable also. It's definitely there in all of our life. We need to learn how to handle it effectively. Yeah.
Okay, so we go to the last topic, the personality is very important. So personality actually refers to the unique way. Suppose in your party, in your office, you arrange some party, and you will immediately you can say, okay, these 4 people are going to come, these 2 people will not come, these 2 people may come. So when we are saying that, we all in a way are assessing the personality. So we know their personalities. We will, if you ask any person to describe, suppose if you ask you to describe your boss, you will describe this boss is either okay, kind person, helpful, friendly, this kind of terms is, or he is very angry, irritable, not dependable. So for the staff, the boss may will have is punctual, obedient, dependent. So all this we are doing, we are assessing a person's personality. So each person, each of us have a unique way of reacting in a given situation. We almost always behave in the same way throughout our lifetime. So that is refers to personality. This word came from mask. In Greek, in Latin, they used to call persona. So in those days, in the dramas, they used to perform with different masks. A smiling fellow is a joker. An angry fellow is a kind of villain. So from that, this word personality came. And this is quite stable across lifetime. So then you ask the question, what is this personality development courses? Anyone taken personality development courses? And personal development course. So actually by definition, personality cannot change unless there is a traumatic, very severe psychological event or some physical like a stroke or something, it won't change. So what happens in personality development courses, you give skills which are like skills like time management, communication skills, and goal setting, problem solving is particularly important. And then all these are a set of social skills which are packed under a thing called personality development. So it's quite catchy name, so it's there. So nothing wrong about it. So what happens actually coming to stress, stress is the balance between your resources and your demands. There are demands from your job and there are resources. So the job demands you cannot change, that is paying and you will have the demands. So you are increasing your resources, your communication skills, your time management, your problem solving, your prioritizing, your assertiveness. All these skills help you to function better and reduce the stress. You can also reduce the stress by reducing your demands. Suppose you took a big loan and you have to pay car loan and you have to compulsorily pay, then you will be naturally under stress to work more. So there is a two way of dealing with the stress thing. So coming to last slide of the personality. So then there are personality disorders. So these are abnormal, means they are quite grossly different from other people. They cause problem to others mostly, sometimes to themselves also. So there are three different categories of this thing. One is one grouped as paranoid, schizoid and schizotypal. I don't talk about schizoid and schizotypal because we don't have. The paranoid personality is one which is important. Paranoid personality person is very suspicious. If you have your boss with this personality, you are done. It is better to leave that job, I will tell you, because every single activity of yours he monitors and he is suspicious. This kuch hai, kuch mein kuch kala hai, dal mein kala, something like that. So some gadbad is there. Why this fellow has come to me? If you ask for leave, why he is asking for leave at this point? What is happening? So he will think. So he makes his life also difficult, but he doesn't understand. And they are very prone to make complaints, long litigations, and they keep the grudge. They don't forget the grudge easily. So paranoid personality, the husband may be very suspicious about his wife's moves also. So they are very difficult people. So just understand this personality. And then there is another personality which is usually this antisocial and borderline. Antisocial personality disorder is basically a kind of a criminal, roughly saying, like they don't have any regard for the rules. So they break law and they don't feel bad about it. They justify this thing, and they are aggressive. They are kind of gunda, all type of thing. I should not say this, but they can become MLAs and MPs also in our country. So that is how the high proportion of them will end up in jails. So this is antisocial personality disorder, and this, if person is that personality disorder, don't think that you can change him. It's very, very difficult. For any personality disorder, if you make it, you understand that this person is going to be like this. So the best thing is, what is that called? Dusto Duravarjita. Keep that fellow away. So that is the goal. And then borderline personality. So it is very similar to antisocial in terms of impulsivity, aggression, anger, loss of control, mood changes very quickly, but they are not criminal. If they do something, they regret. They are not kind of habitual offenders, because their lack of control of impulse, the anger, emotions, they may come across as antisocial, but they are nicer people in a way. Right? And then you have histrionic and narcissistic personality disorders. Can you add on the histrionic?
So I will just
because
add to
you deal more with the histrionic husbands.
That's right.
Narcissistic husbands.
So I would add on a little bit on the way with borderline, or we call it emotionally unstable personality situations, where they find it very difficult to contain their emotions, regulate their emotions, and there is fluctuation in the emotion very significantly. So today they will be like hugging and saying and kissing that you're so important, I love you so much, and the evening they'll be like, you're the worst thing that happened to me, and then the next day it's like again going back. Not in a normal fluctuation, but an intense way. And you will also find them sometimes finding they have this kind of chronic emptiness feeling inside. They have a lot of low mood, and you'll also find them having certain self-harm tendencies. You can find people with cuts on their wrists, like not with an intention to die, like they harm themselves. There will be marks on the hands or some other places. So things like that you will find in individuals having emotionally unstable personality traits. And histrionic is when they have this feeling like, oh, they have a little bit more importance and attention. So I know they might dress up like that in situations where it is not appropriate, maybe present like that, taking up a little more attention. Basically, there's a lot of seeking attention from the group at a larger level and presenting themselves as very important. And narcissism comes in a way that they love themselves so much. It's good to love yourself, but to an extent that there's a complete disregard of other people and what their preferences or anything is. So the most important thing is that they worship themselves. Then only after that God comes. Okay, so that's the kind of style you will find. So very much of these the popular terms, like they use gaslighting, all that terms where they manipulate others. So all these you will find in individuals having such personality traits. And see this as a continuum. It's not like a disorder that, okay, after you cross this line it's a disorder. No, it's a continuum. Like if I'm brilliant, I'm also prone to be skeptical at another end. I may be charming, but I can also be manipulator at another end. So there is perfectionism like that. There are tendencies, different personality traits come together to form a particular personality disorder, and that's an extreme that we have to deal with. Yeah.
Okay, very quickly we have other personality like avoidant and dependent. They both go together. So these personality types usually they cannot take decisions for themselves. They are very dependent on others. Everything they want reassurance from somebody. They are not lack of confidence. Can't take decisions on their own, and these are called dependent, and they also avoid situations where they find it going to be difficult. So this kind of people also you will find at your workplace. They need to be helped to overcome that. And then you have obsessive compulsive personality. The obsessive compulsive disorder is different, and this is different. Obsessive compulsive personality is another this thing. if your boss has got it, again you have a big problem, because they cannot, everything, they are very meticulous, perfectionist, and they want everything to be their standards. Their standards are so high that it makes them very difficult for other people to achieve that standard. And they want things to be exactly in the same position, same thing. Suppose husband has a problem, he wants at the house everything to be arranged. Slight change, he will get very annoyed. He wants to know everything, every small detail. So they make life difficult for themselves and to others. So some of these people actually end up in divorce also, because the wife finds it very difficult to put up with him. So this is another personality type, and bosses also are very difficult, because paranoid and this obsessive personality bosses are very difficult, because they make their staff life very hell actually. Yeah. So these are about personality disorders, and I think we have done questions few minutes, because yeah.
So prevention.
Yeah, you can.
So like a little bit about how do we take care of ourselves. Now you know these are all different conditions and all that. That's there, but it's not applicable to most of us at most of the time. So we are doing okay, but can you still do better? That's a possibility, right? You don't need to reach a psychologist only when you have extreme depression. You can come to us, even say that I'm doing okay, but is there a way I can still do better? And what is that I can do right now to prevent me from getting into this kind of spaces? So the few things that we would suggest that we follow is that some self-care routine for yourself. Self-care is like your sleep, that is 7 to 8 hours to the extent possible every day without disruptions. If you can have it, that's important, and that is going to help not only for physical health, even for your mental health. You don't sleep for 5 days back to back, or 1 week back to back, you will definitely see a psychiatrist. There's no doubt, right? So that's the way how important sleep is, and there is no catching up sleep. It doesn't work that way. Like you don't sleep for 1 week, then you will sleep 1 full day, and then it kind of sleep debt is not something like that. So you need to have it as a routine every day, if possible, sleep for that particular time period. Some basic physical activity, 20 minutes to 30 minutes, if you can at least walk, climb, run, whatever is helpful. Go to a gym, dance, put a song and dance, nothing else. If you can't do a yoga, do whatever works, a basic movement, and eat nutritious food, watch what you're eating, and be mindful about what you eat, at least space out the time. Most importantly, have some good people around you. People that you can connect with, people you can share. Now, sir said mild depression and all, the interpersonal therapy that is quite effective, and many other approaches they talk about, not only behavioral activation, but also interpersonal connections that facilitate your mood. If you have a good person to share what you're going through, and that person is supportive, it kind of prevents you from going further deep from a social aspect. If there is a biological vulnerability also, but there is a good support system. Like your children can come and talk to you about what's going on in their life. If they trust you that much, you're providing a space where it's much protective for them from slipping into a mental health condition. So having that space, having people around you whom you can depend on, and be a person that others can depend on who are in your close circle, is an important factor. So sleep, food, exercise, social connections are the basic cornerstones, and have a schedule that you can understand and prevent, and like basically prepare for. Have some time for yourself, having that personal time, because most of the time we find people not having a personal space and time. They live for others, and they don't have time for themselves. Relaxing or going to watch a movie or a spa or anything is a luxury, like to take care of themselves. I'm saying that make it mandatory that your own personal time is there, and block that out and tell others that this is the time in the week I don't want to be disturbed. You want to order food, you order food from outside. Don't ask me. This is the time I'm going to keep myself. I'll do what I want during that time. I'm going to relax. I'm going to probably play Sudoku. I'm going to color and sit and paint. I'm going to just iron my clothes because that's what I like. Or I'll water my plants. Or I'll just go and walk. Whatever is helpful. Find a time for yourself as a personal space, if possible every day. If not, whatever extent possible, have that for yourself. These are some ways in which you can take care of yourself, nurture yourself, and make sure that you do not fall into that space where things are complex and complicated.
Sir, at what age in children this thing ADHD gets developed? Because we see in family also many children who are so hyperactive, superactive, morning to evening, and they can't stay at one place for more than 10 minutes. So how do we identify and also feel that they have this problem, or is a natural thing?
No, usually, see, the diagnosis can be made from the age of 5 onwards, but usually we tend to see children in the school, because when the teachers start complaining that the child is not able to sit and not able to focus, disturbs other children, so that kind of things, usually school-going children come to us. But sometimes the child may have a problem, but in our system there is a lot of small classroom. The child may be able to sit, but once they go to higher, like intermediate and all that, they have to read quite a lot and focus quite a lot. Then they may the problem may come up. Because I have seen one in engineering. He was in engineering till the time he was having a lot of one-to-one tuitions and he had no problem. Once in engineering, he was not able to stay for more than 15-20 minutes, then they have come to me.
So, if you ask a parent, almost all parents say, my child is hyperactive. So we don't look at that from that space, we look at it from a clinical space, whether it is intense, serious, the symptoms really match, is it really, to that level that to qualify for a diagnosis, it has to be that much, it has to be that disruptive, and the child's functioning is affected, and they get distracted easily, they get, their attention span is very low, so we will have to see all those aspects and interview them to, detailedly to diagnose.
Sir, so this is a common question for all on today's present generation, sir. Today everybody is addicted to cell phone. It has become a body part. So how to reduce this body part to disconnect it from the cell phone? Continuously, in speeches also people got send messages and further. That is, of course, before it is invented, we were never used to that. Now it has become an habitual and addicted. For this, any tips from you?
See, see, for any addiction, there are two things. One is the person has to identify that he has a problem. He has to agree that he has a problem. And then he has to have the motivation that I will do something about it. I will change it. Then the change has to come from himself. So this is a problem, okay, I keep away for this much time every day. Even if it is when I am free, I will definitely see. If the lecture is boring, I will also look for, I don't say it's a problem. But if I am neglecting my other work, then the criteria comes. Because of this, you are ignoring something else. That is an that is the problem. So if it's not causing that problem, there is no issue.
Addiction, because people are
no, using is not addiction. See, suppose if you are not doing something which you are supposed to do because of that, then it is a problem. That is the key thing.
Just to add on to that, sir, you are a product for the companies, and there are thousands of psychologists working there to make you addicted to this. So, it's your duty to understand that what is important to me, is it taking up this much time of from my life, am I really functioning, is it important, I need to, watch my, how much time I'm spending and everything, so that's.
Where to stop?
Important.
Yeah.
Okay.
Taking,
if there are more talks, we can talk during lunchtime.
Sir, we'll have one last question. You can connect with the speakers during the lunch break.
Hello. Can I?
Yes, sir. Yes.
Yeah. So, taking the point which you explained very well, anxiety and stress. Okay. So my question is whether anxiety, creates a stress or stress creates anxiety. Point number one. Whether it's a habitual or by behavior, how do we come? And third is, so better is to manage stress or anxiety?
Stress is only a perception. Anxiety is a medical diagnosis. Stress is your perception that I am under pressure. There is too much for me. It is totally a subjective feeling. Stress is a subjective feeling that I am not able to cope with this thing. If usually they are taken together, because when the stress is and anxiety, they are commonly associated. When the stress becomes too much, then they develop symptoms of anxiety, that is worrying and palpitations and whatnot. So that becomes anxiety. So the management is very similar to both, like relaxation methods, breathing exercises, like kind of thing. Yeah.
So just to add on to that.
No. See, anxiety, there is a definite symptom production. It is connected to brain and chemicals itself. But you can reduce it by using relaxation methods, like breathing exercises. You can calm down. But if it doesn't work, then you go for medication also. Not alcohol.
Not alcohol.
Hello. Sir, last question. As you said that there are this kind of personality disorder, we understand. But my question is how to deal with this kind of personality disorder, because that is the application of knowing these factors. And can we do really something to help them? So we can make our life easy, because we have to deal with these people which are, it can be my uncle, it can be my sister, and we don't know whether they are actually having these problems, and we don't know how to diagnose or screening this. So that is my question, that how we can help them to make our life easy, or how, like what the applications we can do for this thing.
One thing is, suppose if you suspect your family member is having personality disorder, one is you can kind of bring them to professionals for help. If he's agreeing, he will come, right? You can encourage him to kind of go for a screening questionnaire or something, chart GPT, whatever. That also he may be, it is all his problems, it may suggest, and he may be motivated by that. The next is, you yourself can go and discuss with a professional, and if you understand what kind of personality disorder, and then how you should behave. So each personality disorder, how we should deal is, for example, the paranoid personality disorder. So for them it is better not to go into intimate areas, to be kind of at a distance. So like a friend, neutral. If they go too close, they will become suspicious. So like that, for each personality disorder, how to deal with them, some helpful advice can be taken. But if the person himself is willing to therapy, then the cognitive behavior therapy is very helpful. Cognitive behavior therapy can provide insights into their kind of personality, and that the person identifies. Then if he wants to change, he can make some amendments. But generally personality is egocentric. The person likes what he is, and he doesn't see any problem with this. An obsessive person thinks, I am perfect, these people are lazy, these people don't have time, they are careless, and they want me to relax my rules. So that is how that person will respond. So they don't see any problem. 1 minute, yes. Last question. You can talk. Yeah.
It would go on because everybody has a question, so I think we'll take this as the last question.
Sir, I would like you to draw a connection and analogy with entrepreneurship and business and bipolar disorder. So here there is we have discussed that in bipolar there is a low mood, then there is a normal, and then there is a high. And the high is usually connected with risk taking, where suddenly some ideas get connected, people become hyperactive and they take a risky decision to do something or start something. All entrepreneurs are like this only, because entrepreneur is a person who takes the risk and he sees a reward in taking that risk. And entrepreneurs also get the ideas only in certain situations. The normal situations he won't see the opportunity. But where other people are not seeing the opportunity, suddenly he gets the connection and he sees that there is an opportunity and I should go for it. So can you just, because another thing, now when policies like Startup India will come, they will add up to this thing. So that means bipolar disorder will increase with this problem. No, this is the motivation, right? When 91 to 98% of startups are bound to fail, which is a statistical data all over the world. When we know that 98% people will fail, why we are implementing that? Because it will reduce unemployment. People will be self-employed, they will be focused, they will not get diverted. So can you throw something, the connection, so that it helps entrepreneurs? Because we are here entrepreneur people coming for this event. So can you tell us how it will affect and how it can be balanced?
So basically this is an investment decision, right? So investment decision, somebody, suppose one has to discuss, actually the seniors can advise better, because one has to discuss with their other people, lot of people. See, it's a major decision taking, and they have to discuss with not only with their friends, professionals or consultants, and they should take a decision. So whether it has an underlying bipolarity, that is very difficult, because a person is enthusiastic, we can't say that he has got a bit of bipolarity or something. But there are certain professions, so far we knew is that filmy professions. They have more of mood disorders or this histrionic kind of personalities. But I am first time listening that business people also are something to study.
No, sir, I would like to add here. So, thank you for asking the question, because I think there is a connection that I need to make here. Risk taking doesn't equal to bipolar disorder, right? I am taking a risk, but a calculated risk. I am taking a risk in investing in this company, not blindly, not impulsively, not just like that, random. There is a lot of work that I do before I make that risk and take that risk in that particular, decision. And that is not what you see in a bipolar disorder. There it is completely random, impulsive, without probably even a logic. And it is coming from an elated state of mind that they come abruptly like, okay, oh, you want some money? Okay, here is some money. Right? And there is absolutely no rational thinking happening there. So that's why I don't agree to that part that all entrepreneurs have a bipolar tendency. No, it is that they may be having a risk-taking behavior, but that's a calculated risk. And maybe 80% of the time it might flop. But still, it wasn't coming from a space where they did not think and process and discuss. There is a process that they follow. And that makes a difference. Yeah.
Perfect. Yeah. Thank you for the patient listening. Thank you.
Yeah, thank you, Dr. Keshav Rao and Baijesh Ramesh, for the wonderful presentation. This presentation was made only for this session, and a big round of applause for our doctors over here. I think as we were sitting and listening to the doctors over here, we were correlating as to who are the people in our family, are the people who are close by, who must be having this kind of a problem. And then our doctors over here did a good job, so that, we'll find many of them coming to them for their advice. And at the same time, they did a better job by also giving solutions to the problems that are there. So we will break for lunch now, and then thereafter we have 3 more speakers speaking, and this will be on sessions on psychology in business. So we have 1 hour break, and in this 1 hour break, 45 minutes break. Please get in touch, 40 minutes. So in this time, please get in touch with the doctors. You will have many questions. Please talk to them personally, and you can take it up. 1 minute.
Thank you, Dr. Keshav and Dr. Baijesh. Thank you for the insightful session. So may I request our past president, Shri Anil Agarwal ji, to please present a memento to Dr. Keshav Garu, as a token of gratitude. Yeah. May I request Shri S. Tirumalai ji to please present a memento to Dr. Baijesh ji. May I request Shri Premchand Kankaria ji to please present a plant to Dr. Keshav Rao Garu as a token of gratitude.
Thank you, sir. Wonderful. Thank you.
May I request Shri May I request Shri V.S. Raju Garu to please present a plant to Dr. Baijesh ji. So we'll break for a half-an-hour lunch break and we'll assemble on time so that we can have rest of the sessions also completed. Thank you very much for the interesting session, sir. Thank you very much. Thank you.